looks like we are now live. We'll go ahead and get started, and hopefully the others will join. Okay, good morning. Oh, well, let me move that. This way. There we go. Okay. So good morning, all. My name is Patricia Laramie. I'm going to be your guide on this journey. It is not a hard class. Don't try to make it hard. Okay, it's not hard. I'm going to lead you through everything that you need to know to pass the CNA state exam and get certified. And I'm going to make it easy to learn. There is a little work you will have to do, but most of it, outside of physically practicing the skills, most of it you're going to find is pretty intuitive once I explain things to you, okay? So as long as you can stay reasonably awake, we'll get through this together. Couple of housekeeping tips before we get started. Bathroom is just beyond the archway on the right. I don't know what, this is a very small room. I don't know why I have to tell you this, but the fire marshal tells me I have to tell you your exit is there. If that one doesn't work for whatever reason, you got another one right there. If you go out the back, make a right. Don't make a left. It'll run you into a fence. And in an emergency, that's not going to be helpful. So out the back to the right. Smoking area is also out back. Make sure you unlock the door before you go out, though, so you can get back in. I am not that kind of a teacher. If you need to go to the bathroom, get up and go to the bathroom. If you need to take a phone call, get up and go outside and take a phone call. Nobody has to, you're adults. Nobody has to ask permission to do anything. If you need to leave early, feel free to do so. Again, you're adults. Good morning. If you want to find your ID badge there on the table, and then just have a seat. You can eat and drink in this room. I have no problem with that. Come on over and have a seat. I have no problem with that. However, please clean up after yourselves. Dump liquids in that sink before you throw the cups away so that the liquid doesn't get all over everything as I'm trying to bag it up, okay? Sound good? Parking is on either side of the building. Please don't park in the front. If you're parked in the front, on break, I'll have you move just so we can keep those front spaces open for our neighbors. We will get a break. It's usually around 10:45-ish, depending on where I am with the lecture. It'll be a 15-minute break. If you need to go somewhere and get a drink or something to eat, that's fine. If you're a little late coming back, that's fine. You don't have to notify me. Just come in quietly and have a seat. Remember, this is adult education. I'm not going to police you. Okay? There is homework. I know, the dreaded homework, right? Nobody likes homework. There is homework, but if you don't get to it, you're not penalized. You just don't get that information that you're going to need to pass the test. So my advice to you, we have 4 weeks together, and you've got to read that yellow book that's in front of you, and we're going to break it up into chapters. I'm going to give you assignments, but try not to get too far behind, because 4 weeks sounds like a long time to read a small book. It really does, until you get into the 4 weeks. And then before you know it, I'm going to be standing here saying graduation is on Wednesday, and you're going to go, oh, what? I'm not ready. I didn't read. And it's a really hard book to read all in one sitting. So keep that in mind. Okay. On our website, flcnatraining.com, it's on the paper that I put in front of you, flcnatraining.com. I have a link that you can order that book. So if you get behind, because you're going to return that book to me on the last day of class, if you get behind in your reading, you can always click that link and order one. Good? Sound good? All right. Everybody's in scrubs. Good job. So you need to be in scrubs for every class. Black, royal blue, or red. Any of those colors will work. But it's especially important on the last class because we're going to take a class photo. and I want everybody to be uniform. Okay, good. Any questions on anything before we get started? Any questions? All right. So, hello, Emily. Hi. Hello, Marie. Good to see you back. And hello, Latrina. Hello. So for those of you that don't know, this is live streamed. What you see on the screen here in the classroom is what they see out there in virtual world. They're viewed by quite a few people. We're viewed worldwide. So you'll have people on here that are joining us from other countries as well. This is available for you guys to join in. So if you go to, it's on that paper, the single paper in front of you. If you go to flcnatraining.com, that's where my live stream lives. You can also see the syllabus, which tells you how we're going to get through this whole program. But when you join the live stream, when you ask a question, it pops up on my screen and I can put it here and I answer your questions live and in real time. So if you can't come to class on Wednesday, like one of our students from this class contacted me this morning and she's ill and not able to make it to class. So I told her to join the live stream. So if she has a question, she can put it in the chat and I'll put it up on the screen and I'll answer it. So it's all the benefits of being here without physically having to be here. If you are sick, please join virtually. It's a small room and I got a lot of you in here and we don't want to make everybody sick. So if you're sick, and COVID is going around, guys, if you're sick, join virtually. Sound good? Make sense? Just trying to keep everybody as healthy as possible. All right, so let me move over here so I'm out of the way. So this is your CNA class. It is not my class. This is your class. I'm just here to help facilitate it. I've been doing this a very long time, about 17 years. I've got this down to a science, literally. I wrote a book that's used by most CNA programs in the country. I am a subject matter expert on prometric testing. That means that states that have questions about testing, call me. I know everything there is to know about the test and about CNA performance in Florida. I'm going to pass that information on to you. Good morning. You can find your ID badge and then just have a seat. So, like I said, this is going to be easy for you. I'm going to do my best to make this easy for you. It's a little deceptive, though, because of the way that I teach. Now, my program has evolved over that 17 years. When I first started teaching, it was nothing like what it is now. Okay, I've evolved as I've learned, and that's going to help you guys. But the problem is that I tend to make things a little too easy now. And you'll sit over there and you'll think, oh, I got that. I don't need to practice. I'm good. I got it. No, you really do need to practice. Just because you've got it theoretically doesn't mean that you'll have it performance-wise. Does that make sense? Okay, I can listen to classical music and think, oh, I've got that, but let me try to play it. It's not going to happen. I need some practice. Make sense? Good. So the best advice I can give you is, although I'm going to make this seem easy, I have been a nurse for almost 40 years. Crazy, right? I can't make this look hard. I got too much experience behind me. It's not going to look the same way when you do it, though, because you're new. So don't compare your performance to mine, but make sure that you are practicing. Sound good? Everybody good? This class does meet on Mondays and Wednesdays from 9 a.m. to 1 p.m. for 4 weeks. And today I am going to talk nonstop for 4 hours. Literally. Except for a 15-minute break in there. Nonstop. Now, you don't have to take notes. I've done that for you. We'll get into that in a minute. But we do meet on Mondays and Wednesdays. Please don't come on Tuesdays. I won't be here. Okay, Mondays and Wednesdays. You can attend in person or virtually from anywhere. Practice room is available on class days from 2 to 4 p.m. for in-class students only. That's you guys, not you virtually. You guys can all practice in this room on class days from 2 to 4 p.m. Now, while you're enrolled, it's from the end of class at 1 until 4. Once you graduate, it goes to 2 to 4. So that means today at 2, we may have some people that come in. You'll be gone at 1. We may have some people come in that are here from the last class that are practicing getting ready for their test. So that's helpful for you to know. This might change because our hours are going to be changing very soon. And I don't know that we're going to have practice on Monday. If we don't, I'm going to move it to a different day, and I'll just keep you updated. Right now, it's Mondays and Wednesdays, but just be aware that that may change a little bit. After each class, you're going to get a wrap-up email. So after class today at 1 o'clock, you're going to get an email. How many guys got my email yesterday? Okay. If you did not get my email yesterday, check your email. It may have gone to spam. If you respond to that email, just send me something. Okay, thanks, whatever. If you respond to that email, your email provider now thinks that you like me, and they'll make sure that my emails don't go to spam. Okay, that's why I had all of you guys reply to me. It's just a really quick way to get around your email filters. So you will get a wrap-up email after each class, and that's going to provide very valuable links. It's going to go over briefly what we covered in class, and it'll give you the replay to this live stream. So I'm going to go through a lot of information. Like I said, I'm going to talk for 4 hours nonstop. It's a lot of stuff. You're not going to get every single word, I guarantee it. So if you have the link to today's live stream, tonight when you go home, you can play it and just listen in and go, oh yeah, I forgot that she said that. That was important. I forgot about that. And it'll help reinforce. And it's it's not a replay of somebody else's class. This is a replay of yours. Okay, good. You also have free access to the online course. You're going to get an email. Sorry, guys. I get really, really dry when I talk nonstop. So you're going to get an email today. Those of you that are in the class, in the physical class, you're going to get an email that enrolls you into the online course. Our online course is helpful. It takes everything I say and breaks it up into small lessons, and it makes each of those lessons interactive. So I suggest that you go through the online course as we're doing the program because it will help. Some people wait until after they've graduated to go through the online course as a review. That's fine too. I don't grade it. I don't check to see if you've accessed it. It's yours. If you want to use it, use it. If you don't want to use it, that's fine. But it would be very helpful for you. Very helpful. So you will get enrolled in that online course. My name is Patricia Laramie. I am an RN. I've been a nurse for a very long time. And I have worked in a variety of settings. Everything from long-term care to a doctor's office and walk-in clinic to ICU. I was a hospice nurse. I was on an IV team. I've done a lot of different things. And I'm going to bring some of those stories in to the program to make it feel a little more real. Okay. If you choose to share stories, there's 2 things that I require. Number 1, no names. Number 2, no places. So if you have, oh yeah, you can't hold up 2 fingers. It gives us balloons. If you have an experience at a local hospital, please do not name the hospital. Please remember we are live streaming. Okay. So no names and no places. Other than that, feel free to share your stories as we go through. Sound good? Any questions so far? All right. This is my book. You have this in front of you. Your spiral is black, doesn't matter. This is my book. This is the one that we're going to work out of. Remember I said I took all the notes for you? Those notes are going to be in this book. When I tell you in class to open your book too, I'm always referring to my book. You have the yellow book available to you that you're going to take that home. That is for homework reading only. We do not work out of that book. That book is not specific to our state. My book is. However, the yellow book has some content that I don't go over in class. And that's why you have to do that reading. Okay. So when I'm talking about the book, I'm always talking about my book. Good. And I'll show you why in a little bit. So as we go through this class, I'm going to take you to pages that look an awful lot like this. And these are principles. The whole program is based around principles or foundations, building blocks. This is the first one we're going to learn, skill rules. And we also have it as a banner on the very back wall. The very first one you see there, the purple banner, is this. Not to scare you off, but you are going to learn everything on that back wall within the first 2 weeks. You're not going to memorize it. You're going to learn it. It's a big difference between memorizing something and learning something. If you memorize it, you'll forget it once you're out of here. It goes into short-term memory. You can't recall it later. Like I memorized a poem from Edgar Allan Poe in 7th grade. Can I recite it? No. That was a long time ago, right? Memorizing doesn't really help you long term. Learning does. So each one of these principles I'm going to explain to you in detail, and we're going to learn them together. And then we're going to combine these principles to make skills. Okay, so all we have to learn is 11 principles, and we'll use those 11 principles to make 20 skills. So think of them like Legos. Okay. We'll get to that in a few minutes. So we're going to learn skill rules first, okay? And this is going to be featured in every single skill that we learn. All 20 skills are going to hinge on this one principle. So that means that's a good place to start. If it applies to everything, it's probably where we ought to start. And it's called skill rules. And I'm going to show you a video in just a few minutes that's going to explain this. And it is my video, it is my voice, but it's animated. So it's a little bit more engaging. So the notes are going to be in your spiral book. So if you go to page 17 in your spiral book, you're going to see this page. So open up to page 17 in your spiral book. So I want to show you a few features of this page. So first you can see the banner, and this tells you all of the points to that principle, all the things that are important. Down here is a little video clapboard. That means that I have a video for this. Now, I'm not going to show you this video in class. You will have access to it. It's on my website. It's in the online course, and I'm going to give you a link to it in the wrap-up emails. Okay, so it's easily available to you. You can watch it if you wish. In here, I'm going to talk about it. We're going to make it not video. It's going to be more live and in person. But the video is there for you to review. Over here, we're going to come back to this and talk about this in detail. It's actually the same banner that I have right here behind me. That's what this is. And this is going to be extremely important to us in about 30 minutes. But I need you to know where to find it later. Good? Good? Okay. So on page 18 are the notes from the video. I told you you don't have to take notes. Here they are. So I'm going to show you this video. All of the notes from the video are here for you for review. And if you look down here at the very bottom of the second column in bold, it says CNAs do normal. We're going to talk about that right after the video. And it's going to help you understand, but keep that in mind while you're watching this video. It's going to help you understand our role as CNAs. Okay, good? Good. All right, the video is also going to talk about a concept called... That's okay. Come on in if you want to find your ID badge there on the table and then just have a seat. So the video is also going to talk about a concept called activities of daily living, or ADLs. If you want more information on ADLs, you can find more information on page 89. All of this is on your syllabus. Don't sweat it. You don't need to take any notes. I'll point all of this out, but that's where you can find some more information about that. All right, so let me show you this video. This is where we're going to start. If you fall asleep on any other part of my class, I'll forgive you, except for this video. If you fall asleep during this video, I'm going to wake you up. Good morning. You can find an ID badge there on the table and then just have a seat. This video is going to form the foundation of everything that's going to follow in the next 4 weeks. So this is super important. Okay.
The care plan and the CNA, why it's always about the care plan. A presentation brought to you by foryourcna.com. Thank you for joining For Your CNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job. Because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the activities of daily living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone. But we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs, bedpan or catheter. I also know she is at risk for constipation, since she's not moving much and she's on pain medication. This is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does, so you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job! For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
Any questions? Any questions? All right. Jean says, good morning, Miss Patty. This is Cleonta. I took my test on August 30th and I passed. And I already got my license last Friday. Thank you for your support. Congratulations. Super exciting. Good morning, Raz. All right. So how do we know what to do with each patient? Care plan, yeah. We're going to follow the care plan, the whole care plan, and nothing but the care plan. What does that mean? Well, what that means is CNAs can't change the care plan. They can't alter it in any way. They can't think to themselves, well, but if they could do this, that's not your call to make. This is where most people mess up on the test. The test is failed not because you didn't know how to do the skills. It's because you didn't follow the care plan while doing those tests. This is the key to passing that exam. Follow the care plan. So if the care plan tells you to do exercises on one shoulder, and it indicates which shoulder, should you do both? What should you do? Yeah, follow the care plan. Absolutely. Do the one shoulder. Absolutely. The written test is going to specifically try to mess you up on this topic. They want to see, do you really have this? Do you really understand the importance of a care plan? Now, the reason for this is because CNAs kill just as many people as surgeons every year. We just don't talk about it. I think we should be talking about it, right? You're not in this industry to hurt patients. How do we keep from hurting patients? We have to follow this care plan. So a big part of the written test is going to ask you questions based on, do you know your role? Do you get this? Good? Make sense? Let's see if you do. Go to page 20 in your book, spiral book. And on page 20, you'll see 4 care plans, and you'll see 8 questions. So we're going to go ahead and take the next 10 minutes, sooner if y'all get it done, and we're going to answer these questions. So read those 8 questions, and you can write in this book. It is your book, and circle the right answers. Those of you who are joining in virtually, you can complete this activity on your screen as well. I also put the link for the book in the chat, so you can order the book to keep up with the class. Oh, sure. You're welcome. What's that? I don't have any pencils, no. Anybody need a pen? Everybody good? Good morning, Esther. When you're done with the questions, just put your pencil down so I know who's still working. Okay. About 5 more minutes left. For those of you that are done, I just want to bring to your attention, you just answered 8 questions in less than 5 minutes. So we're going to talk about the written test in a little bit, but keep that in mind that you were able to answer 8 questions in less than 5 minutes. So when we talk about the written test timing, I'll explain why you don't need to stress the timing. Those with a language barrier, this is going to be a little bit more challenging because you have to translate in your mind. So it takes a little longer. Okay, most of you are done. Well, you can come back to this on your own. I want to go through these questions really quickly here. So, number 1, it says you receive the displayed care plan. How far will you walk this patient? What'd you guys get? What do you think? Okay. So the answer is 10 steps. How did we get that answer? Because the care plan told us. Okay. Those of you that put B, that makes sense, right? To the bathroom and back to bed. But did our care plan say anything about that? No. And we follow the care plan, the whole care plan, and nothing but the care plan. So if you answered A or B, that means that you put something into that care plan that is not there. That would cause you to get this question wrong. Now, D kind of makes sense. Physical therapy will walk the patient. And in a lot of cases, they will, right? Not our job. But that's not what our care plan says, is it? Our care plan is telling us to do it. So we can't delegate this. We can't say, oh, physical therapy will do that. Not our job. Our job is simply to read that care plan and follow it. That's it. That is the role of the CNA. Read the care plan and follow it, and then report all observations. So how hard can this be, guys? They give you instructions. You follow the instructions. You pass. So you're starting to see why I say this is really easy? Good? Good. All right. So number 2 says, you receive the displayed care plan. What is required to assist this patient to stand? So what would we need to help this patient stand? Why A? Care plan. Easy answer. Care plan. Yeah. So if anybody said B, a Hoyer lift, that care plan doesn't say anything about a mechanical lift at all. So if we went and used a mechanical lift on this patient, we are now liable. Walker, that might make sense for some patients, but is that our call? No. And 2 caregivers, hey, it's always nice to have help, but that's not what our care plan tells us to do. So are you starting to put these pieces together? Okay. You get instructions, you follow those instructions. Now, if you put anything else on these questions, then you're going to have a hard time on the written test. If you can read that care plan and then select the answer that matches that care plan, the written test is going to be super easy for you. Good? So don't stress the test. All right, let's go down here to number 5. So number 5 says you receive the displayed care plan. What is a safety concern for this patient? What'd you guys get for number 5? A, how do we know that the patient is in an inappropriate position for eating? We can't see them. How do we know? Care plan told us. It says right in the care plan they're in an inappropriate position for eating. Now, most of your care plans aren't going to say that. You're going to have to rely on your eyes, but this is a written test. We don't see that patient. They gave it to us in the care plan, and then we have to follow it. So see how these written questions are going to be displayed for you? Okay. And then let's go down to number 7. You receive the displayed care plan. Which vital signs are you going to obtain? How many of you guys wanted to do all vital signs since you're there? Anybody want to do all vital signs since we're there? No? Anybody want to do respirations? Blood pressure? Pulse? Pulse. Okay. Why can't we do blood pressure too while we're there? It's not on the care plan. Not our job. Our job is to read and follow the care plan. But let's talk about why. Let's talk about why. I mean, blood pressures, that's such a very basic vital sign, something CNAs do all the time. Why can't we go in and decide when a patient needs their blood pressure checked? The problem is that you don't know anything about that patient. You don't know their diagnoses. You don't know their conditions. You don't know their situation. You don't know anything other than what the care plan tells you. And you don't need to know anything to follow the care plan. So if this patient had a traumatic injury in their upper arm that crushed all of their bones, do we want you taking a blood pressure on that arm? Probably not. So the blood pressure is not on that care plan. If the patient has a blood clot in that arm and we put a blood pressure cuff around it and restrict that blood flow, that could be really bad news for that patient. It could actually cause that blood clot to dislodge and travel and kill your patient. So if you go in and you do blood pressure on that patient when you aren't assigned to, you could potentially hurt or kill your patient. You guys starting to see how important this care plan thing is? You are not going to have all the information about the patient. You're not going to. As some of you are going, but wait, I need it to do my job. No, you don't. You read and you follow. Good? Make sense? Now, those of you who are saying, but I need that information, you need to go on for nursing school. If your brain is going, but why? What's causing that? You need to go on to nursing school. Good? Because it takes 3 years of nursing school to put all those pieces together. How long are we here for? That's not us. Good? Questions? Now, for the test, you're going to get a care plan. And we know now that we have to follow that care plan. Wouldn't it be helpful if we could actually see the care plans for the test before we get there? If I could give you the care plans from the test right now, would you want them? Right? Sure, I'd like to know what the care plans on the test are going to say. Here they are. Those are 4 of the testing care plans. Now, I told you we're going to learn 20 skills, so what about the other 16? Go to page 25 in your book. These are the exact testing care plan sets that are used in testing. When you go to test, you will get one of these 11 clipboards. You will. There's no 2 ways about it. This is exactly what the test uses to test you. Now, each one of these clipboards has it has something very specific, okay? There's 3 skills on there. One skill is an ADL skill. What do we know about ADL? What does that mean? Activities of daily living. It's things we do for ourselves every day, okay? You get yourselves out of bed. You get yourself to the bathroom. You do your own grooming. You do your own bathing, I hope. You do your own dressing. You feed yourself, and you get yourself off to wherever it is you need to go. And at the end of the day, you put yourself to bed, right? Those are all things you do every single day. Activities of daily living. Good? Now, how many of you have children? Okay, portion of you. How many of you have siblings? Okay. If your child or your sibling wasn't able to brush their own teeth, is that something in your house that you would help them with? Sure. You know how to brush teeth. They're there. They need help. Those 2 things go together. Good? Do you have to be a CNA to brush somebody's teeth? No. It is an activity of daily living. You don't need to be a CNA to help somebody with daily activities. If your neighbor needed help tying their shoes, you can go over and tie their shoes. You don't have to be a CNA for that. So we call these friendly neighbor tasks. Good? Don't have to have any extra knowledge. It's stuff you do every day. That is not nursing. You need to understand that. Activities of daily living is not nursing. Takes no special skills to do those tasks. Now, we are going to learn how to do those tasks on another human safely. So yes, we're going to learn how to brush teeth. We're going to learn how to bathe. We're going to learn how to dress. We're going to learn some ADLs. We're also going to learn some nursing stuff. But we need to understand our role here, okay? So as the RN, if this is my patient over here, my job is to go in and figure out everything that this patient has going on. I need to know their real problems, their potential problems, their treatment plan, their medications, their labs, their diagnostic tests. I got a lot going on over here, right? And it's my job every shift to assess this patient head to toe and look for real problems and potential problems and develop a plan that the rest of us can follow. That's my job. Now, this takes a long time. Real problems and potential. Think about that. You got to come up with all the possibilities that could happen to this guy in this bed. So I have to look at how much protein is he eating? Because if he's not eating a whole lot of protein, that's going to affect his muscles. They'll break down. So I got to look at how much protein he's eating. I got to look at how much weight he's lost, because if he's lost a lot of weight, that means his bones are bonier, and that could affect his skin. I got to figure out, can he even get out of bed? Is he stuck in bed? Because if he's stuck in bed, your digestive system actually needs your tummy muscles to move food through the digestive system. So if he's laying in bed, stuff isn't moving all that great, which means he's probably at risk of constipation. I got to do something about that. If he's stuck in this bed and can't get to a water source on his own, and I got to rely on you guys to take him fresh water, and you're so busy you probably forgot, he's probably at risk of dehydration. Absolutely. I have a lot to do with this guy, right? A lot of stuff I have to think about. A lot of stuff I have to plan. Now, as I'm working with him, he's not my only patient. As a nurse, I got way more patients than this. So if I'm busy with this guy and somebody else over there needs to be fed, should I leave him and go feed the other guy? Now this guy's stuff isn't getting done. So I need somebody that I can ask, hey, can you go feed that patient for me? And have a reasonable degree of assurance that you can, in fact, feed that patient safely and do it exactly how I tell you to do it. That you're good at following directions. Does that make sense? So CNAs help patients with activities of daily living, because those things have to continue even though the patient is not able to do them themselves. And it frees me up to do nursing level stuff. You guys understand the division there? You can actually work at an assisted living facility without being a CNA. Because at assisted living, we are helping patients with activities of daily living, nothing nursing. So you can work in an assisted living facility without being a CNA. If you go over to the one across the street, they'll hire you right now. They are hiring. So this is an opportunity for you to go to work immediately. Now, other settings do require that you have your certification prior to working there, and that's because they need to know that you understand this. Assisted living, no care plans. It's all just personal care. Other settings have care plans. What do we need to know about care plans? What do we do with them? Follow them. That's what sets you apart. That's what makes you a CNA. Good? Make sense? Okay. Now, there's something else that makes you a CNA, different from everything else. And that is the ability to observe and report. So if we go back here, There it is. We go back here. This is what we call the care planning process or the nursing process. So as the nurse, I go in and assess that patient head to toe, look for real problems and potential problems. And the information that I gather through that assessment leads me to develop the care plan. Care plans are very long, very complex, and they're not just for you. They're for the entire treatment team. I'm talking to the dietitian in the care plan. I've got things in there for physical therapy and occupational therapy. I got stuff in there for social services. I got stuff in there for discharge planning. I got stuff in there for everybody, not just CNAs. But you are going to have some stuff in the care plan that tells you what to do with that patient. Now, while you do those tasks that are assigned to you, your big job here is to make observations, because anybody can help somebody brush their teeth. What sets you apart is that you know what normal is and how to recognize abnormal and be able to report that back off to the nurse. Because when you make that observation and you report it back to me, that makes me go in and reassess. And that can change the care plan, which gives you different tasks to do. While you're doing those tasks, you make observations, you report them to me, I reassess the patient. So making observations, knowing your normals is a big part of what a CNA, a big part that sets a CNA apart from other modalities. Good? Questions? Now that's because the places that we have to be CNAs to work are very few. Very few. Where do you think you need a CNA certification to work legally? Give me some options. Hospital. How many of you guys think you need a CNA to work at a hospital? Legally, you do not. You do not. Legally. No, they prefer it. That's an employer preference. You know, I own the retail store next door, the scrub shop. I hire people to work in the scrub shop, and I could require, if you want to work in my scrub shop, you need to have a doctorate. I can require that. You think I'm going to get somebody with a doctorate to sell scrubs? Probably not. Okay. Now, I can require it as an employer. There's nothing that says I can't. So when you look online at job descriptions, it may say CNA required. That does not mean it's a legal requirement. That is an employer requirement. I'll explain why in a minute. Where are some other places that you think you have to have a CNA to work? Nursing home. Okay, yes. Actually, you have to have a CNA to work in a nursing home. You have to be certified. Where else do we need a CNA to work? Okay, with Alzheimer's patients. Depends on the setting. If it's in an assisted living facility, no. If it's in a nursing home, yes. We'll talk about that in a minute. Any others? The only other place that you're required to have a CNA certification is home care, if you do not have a home health aide. That's it. So nursing homes and home care. Those are the only two places that you are required to be certified to work. Now, other places may prefer it. They may have it as an employer requirement, but not legal. So let's talk about why. Why? Why do I not have to have, you would think that hospitals, top of the list, ding, 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 should require a CNA certification, but they don't. Remember I said that there's one thing that sets CNAs apart from other modalities, and that is the opportunity to observe and report. So in a hospital, we have nurses everywhere. Those nurses, because our patients are critically ill, they're acutely ill, those nurses are able to assess the patients frequently. You got lots of nurses, lots of nursing time. The patients are seen by nurses quite frequently. So they're going to pick up, they're going to make those observations themselves. They don't need you to do it. You guys understand that? Nursing homes, there aren't very many nurses. And our patients require nursing care. It's all in the name. Nursing home, nursing care. Remember, ADLs are not nursing care. Wounds, tube feedings, frequent assessments, IVs, those are nursing care. Okay, so our patients are more ill. They need nursing care, but there's not very many nurses around. So we need people that can follow directions and are trained to make observations and report them. Same thing in home care. In home care, you don't have a nurse standing around. So you must be trained to make and report observations to work with patients that have a nursing need. Is that a little clearer for you guys? A little clearer? So as a CNA, the thing that sets us apart is the ability to recognize abnormal and the responsibility to report it. And we only need that in a couple of different settings. Rehabs can employ people. You don't need to have your CNA to work in a rehab because, again, lots of nurses. They may prefer it, but you don't need it legally. Okay. Things like working in a pediatric facility. Again, not legally required. They might prefer it, but not legally required. So when you're looking for jobs, remember 2 places you have to have a CNA is nursing homes and home care. All others, you can still apply. It's not legally required, but they may not hire you if you don't have it based on their preferences. Good? Questions? So this is how we get the whole alphabet soup out there. We've got patient care techs, patient care assistants, nurse techs, rehab techs, patient care attendants. I mean, there are so many different names out there. All of it means nothing. It means non-certified because the only way you can be a CNA is to get certified. If you're not certified, you're not a CNA, we got to come up with another name for you. Let's make one up. And that's what all of those terms mean. It's just what that facility calls people that help patients that aren't certified. That's a really confusing thing, isn't it? None of that is regulated by the state. Actually, none of it is regulated by the country. It's very confusing. Remember, certified gives you the CNA, the C part of CNA. Okay, good? Questions? All right, so these are the care plans from the state exam. You will get one of these. This little number in the circle tells you how long you would have to do that set of skills. Each one of these skills or sets has an ADL skill. Remember, that's activities of daily living, a mobility skill, and a documentation skill. So that's how each one of these care plan sets are made up by Prometric. Good morning. All right, so let's go to page 22, and we're going to learn a little bit more about our scope of practice. So if you look at the top, very top of this lesson right here, you'll see that little video clapboard. That means that there is a video for this. It's in the online course, and it's on my website. You can watch it if you want to. I'm not going to show it to you in class. And then this is a lesson that explains the importance of following the care plan. But let me go through 1 or 2 of these with you so you can see why not following the care plan might hurt the patient. So the care plan says the patient must remain upright from 7 a.m. to 9 a.m. every morning. That's our care plan. So patient has to be sitting up between 7 and 9 every morning. Sounds okay. Doesn't sound like a big deal, does it? Just have the patient sit up between 7 and 9 every morning. But at 8 a.m. or 8:15 a.m., the patient says, hey, my back hurts. Can you lay me back down? What do you think? Can we lay her back down? Why? She says her back hurts. Say it louder. Say it louder. The care plan. Care plan says they have to be sitting up between 7 and 9. It's 8:15. Can we put this patient back to bed? Who should we tell? The nurse. So we're going to go find the nurse and say, hey, the patient has a backache. They want to go back to bed. That's important because the medication that I gave her at 7 a.m. that requires her to be sitting up can cause a very serious side effect, and a backache is one of the prime signs of that side effect. Now, if you had just gone in there, she asked, can you put me back to bed? And you said, sure, I'll put you back to bed. And you never told the nurse because, hey, she just wanted to lay down, no big deal. You could have killed that patient. Ooh. Are we here to kill people? Wrong class. All right. So let's go down to the very bottom here, the first column. It says, care plan tells us to restrict fluids to water and juices only. The patient requests a diet soda from the vending machine and gives the CNA money. Says, hey, here's a 20. Keep the change. Just go get me a diet soda. No calories. I'm dying here. I really want a diet soda. Can we go get him a diet soda? Even with an $18 tip? No? Why? Say it loud. Care plan. Care plan says water, juice. Water, juice. So we're going to say, no, dude, I can't. Sorry. I'm not allowed to accept tips either. But I can get you some water or some juice. Which would you like? Who should we tell? The nurse. Now, this doesn't seem like anything we would have to report to the nurse. No big deal, right? He's just asking for a diet soda. I didn't let him have one. No big deal. Do you know who else this guy's going to ask for a diet soda from? Everybody. Absolutely. The phlebotomist, the x-ray tech, social services, the volunteer that brings in the paper, the diet person that comes to take his lunch order, and his family. You think they're going to tell him no? Probably not. They don't know what a care plan is. You didn't either before you walked through that door an hour and 15 minutes ago. So because this patient is asking for a diet soda and it goes against the care plan, your nurse needs to know about it because they got to educate the patient on why that diet soda is a bad idea. It could be because the caramel coloring in that diet soda might throw off a test later. It could be because we're trying to flush his system prior to a colonoscopy later. It could be that we're trying to get his blood sugars down. And even though that's a diet soda, it still can affect blood sugars. There's a lot of reasons here. Do we need to know them all? No, we just need to follow the care plan. Are you starting to see how this all kind of goes together? Good. So these questions on the test are going to specifically try to see if you know how to follow a care plan. That's the job of the written test. Can they trick you into not following the care plan? Now, if you have passed all of these questions that we've been talking about with no problem, oh man, that written test, you'll be laughing at it. It'll be easy. If you struggled with this concept, you probably want to watch this video. Okay, good? All right. So let's go to this. I told you we were going to learn about this. This is going to be on page 13 of your book. It is the banner right here to our side. This describes our scope of practice as a CNA. We call this the happy CNA place because as long as you're in this place, you are safe and have no liability. None. Zero. Nobody is ever going to sue you for anything as long as you stay in your scope of practice. The nurse has all of the liability. 100%. That nurse is legally liable for everything that happens to that patient on their watch. Everything. So if I tell you to, I don't know, use a gait belt when you get the patient up and transfer them to the wheelchair, and you decide on your own to use an electric lift because you don't want the patient to stand, and something happens to that patient, do you think I'm going to take the fall for you? No. I told you to use a gait belt. You decided on your own to do something different than what I told you. I'm not taking liability for that. So if you are not following the care plan, you are liable for your actions. And you don't want that because when a lawyer gets involved, and a lawyer will, when a lawyer gets involved, they are going to grill you like there's no tomorrow. And they're going to say things like, where did you get your nursing degree? What gave you the impression that you were able to dictate actions for that patient? Why did you feel that this was a safe choice to make for that patient? They are going to just throw you to the wolves. So your only choice here is to say, I follow the care plan, the care plan, the care plan, the care plan. And then the nurse takes responsibility. So as long as you are following the care plan, you have no liability. It's when you step outside of that that things become sticky for you. Good. Now, I do want to talk about this real quick because this is a big trend that's happening right now. And I just want you to be aware of the pitfalls of it. A lot of CNAs are putting ads out there like on care.com or, Facebook Marketplace or whatever. Caregiver will come care for your loved ones in your home, right? They work for themselves. CNAs work for themselves. Who's got the liability? You. 100%. Where's your care plan? Wait a minute. CNAs follow the care plan. If you don't have a care plan to follow and you're taking 100% liability for everything you do, you must not like your house. It's a huge risk. And it might start off great, but it never ends that way. Be careful. Not telling you not to do it, but you need to know the risks. All right, so this is our happy CNA place. It all starts with our foundation is the care plan, the whole care plan, and nothing but the care plan. You take that care plan away, you don't have a house. You have nothing to stand on. That's why it's the base of everything. Now, off to the side, we have CNAs do normal. Now, I've got to define normal for you for this to make sense. Normal means a routine task on a stable patient according to the care plan. So let's talk about routine tasks. Routine tasks are things you've been trained to do and that you've done enough that it is simply routine. No curveballs, nothing out of the ordinary, nothing strange, just brushing teeth, range of motion, dressing a resident, nothing out of the ordinary, routine. The patient has to be stable. So you're not doing mouth care on somebody who's currently coding. Okay. Stable patient. And it has to be dictated by the care plan. You can't decide to do that routine task on that stable patient. It's got to be assigned to you. As long as it's a routine task on a stable patient, according to the care plan, it's considered normal. So, this is really going to mess you up. There are places that you go to work where you are going to have to learn new tasks. I'm going to teach you 20 tasks in here that are very common to CNAs, but it doesn't mean you're going to use all 20 of these tasks wherever you go to work. Because some of you are going to go to work in a place that requires different tasks. So let's say that you go to work in a rehab center, okay? You're going to be helping people with bathing, dressing, grooming, transferring. They just got done with surgery or they just had a stroke. And you're going to use all of these skills. You're going to be well prepared. You're fine. You go to work in a same-day surgery center, post-op. So a same-day surgery center is a place where patients go in, they have surgery, they go home that day. Okay? Stable, normal, right? So one of the things that we have to do before we send these patients back home is take the catheter out that we put in during surgery. That is a routine task. Your patients are stable, they're about to go home. So I can train you to take a catheter out. Routine task, stable patient. You can be trained to do additional tasks. Good? Make sense? Okay. Now, let's say that you leave your rehab or your rehab center. You go to work with her in the same day surgery center, but you go to work in pre-op. Now, pre-op, still routine patient, right? Routine tasks, so stable patient. But they ask you to learn how to, I don't know, perform surgery, right? You haven't been trained to do that. That's way outside of your scope of practice. Does that make sense? Okay. So there are some things legally that nurses can delegate. There are some things legally that nurses cannot delegate, but it's not really up to you to figure out which is which. That's up to the nurse in the facility to sort out. Your biggest flashing light thought process here is, have I been trained to do that task? And is it a routine task on a stable patient where we don't really expect anything to go wrong? If it's a task that's routine, let's say brushing teeth, but your patient has a hole all the way up into their sinuses that has breached into their brain. And yes, that does happen. Mm-hmm. Do you think we want to put toothpaste in this person's mouth if we have a direct access to their brain? So even though mouth care is a very routine task, is this a stable patient? No. So you won't know everything about the patient, so it's always up to us to follow the care plan. Good? You guys understand the legalities here? Okay. So CNAs do normal routine tasks on stable patients according to the care plan. Now on this side, we have principals guide performance. Now, that's a whole mouthful, and I'm not going to get into this too much right now, but the principles are everything we're going to learn back there, and that teaches us how to do the skills. Okay, how to brush teeth, how to do bathing skills, how to help a patient stand or walk. The principles are going to teach us how to, and we have to follow those to stay inside our happy place. If we start doing things different than how we were taught to do them outside of our principles, we're putting our patients at risk. Now, above it all, above everything, we report all observations to the RN, no matter how small they are. And we have to remember, like, we get all tied up in these things, right? All of these things we get all tied up in. But at the end of the day, over everything else, we have to remember it's not about us. Who should it always be about? The patient. That's right. So above all, everything has to be about the patient, not us. Now, I'm going to tell you, that is my hardest job in here. It is my hardest job to get you to stop thinking about you and the test. Because right now you got that test in your headlights, right? You're thinking about the test. You're stressed about the test. Oh my gosh, I want to pass the test. You're thinking about it. You're going to be thinking about it a whole lot more the closer we get to it. My job is to get you to stop thinking about you and start thinking about the patient. Because if you can shift your focus to the patient, you will automatically do better on the test because that's who they're focused on. They're not focused on you. Every action you take has a consequence on this patient, and that's what they're grading you on. We'll get to that. So above everything, it is all about the patient. Now, this is so important to me. This is so important to me that it's on the back of your ID badge. It goes with you everywhere you go. If you ask me a question in here, I guarantee that my answer is going to have something to do with one of those 5. Something to do with one of those 5. Every answer I give you will tie back to this. Every answer I give you. Because this is what's keeping you in your scope of practice. Good? You guys will all come up with what-if questions. All right. So delegation, I have a whole lesson on this. Page 14, we talked about this. Remember that the RN is the one responsible for the patient. They have the liability. Our job is to follow their directions. It really is that simple. If they ask you to do something that you haven't been trained to do, you just let them know, hey, I haven't been trained to do that. And if it's important to them, they'll train you, or they'll have their facility trainer train you. Training does not have to be in a classroom. Training can be done at the bedside. I can train you right now to do whatever task I need you to do. RNs can train at the bedside. It doesn't have to be in a classroom. But your responsibility is to not do tasks that you haven't been trained to do. Don't pull out your phone and pull up a YouTube video and try to wing it. Okay? Yes, that happens. Oh, I could tell you stories. So when the nurse says, I need you to, your immediate thought should be, am I allowed to do that? And the answer is, if I have been trained. Okay, good. I am plugged into hundreds of CNA groups online, and this comes up daily. Am I allowed to? And my answer is always the same. Were you trained? Were you trained? Were you trained? Were you trained? Okay. And we talked about this too. Remember, you have no liability as long as you are under the care plan. If you're following that care plan, you have no liability. The nurse retains it all. So we're going to start talking about the CNA test now. And this is going to start on page 12. And in the state of Florida, we use prometric testing. Lots of other states do too. And this test has 2 components to it. It has a written test and it has a clinical skills test. Most people in Florida test as challengers. Like 80-something% of people in Florida are testing as challengers. That's what you're going to be testing as too. Some people, like 12%, go to actual 120-hour CNA programs. They're very rare, they're hard to find, and they're insanely expensive. That's why most people don't go to them. Now, those people who go to a 120-hour program, they don't have to take the clinical skills test anymore. So they don't have to do the skills part. They can just do the written test. So there is a benefit to taking a 120-hour program. But like I said, they're insanely expensive. And when this rule went into place, man, they all got really expensive. They all tripled their prices because they now know that you can skip. There's a benefit, right? So to me, it makes more sense to not pay that money and take the test, because I'm going to teach you how to get through the test super easy. Good? Questions? But if you hear somebody say, oh, yeah, you don't have to take the clinical test in Florida anymore, that's only if you took one of those 120-hour programs. It's really expensive and goes into nursing homes and practices on real people. And here you're going to practice on each other. Save yourself some money. So we have two parts of the test. You've got a written test and a clinical test. Let's talk about the written test first. Well, I'm sorry. Let me talk to you about the testing facilities. You have to go to a testing facility to test. Our closest one is in Tampa. Actually, there's two in Tampa. There's one like right off the Parkway, and then there's one way over like by Busch Gardens area. You can go to either one. If you're in Citrus County, there's a couple in Ocala and Silver Springs, but they're in larger cities. We don't have anything close to us. We were a testing facility here for about 5 years, but they moved them all to large cities, not small areas. So our closest one is in Tampa. And you can, for those of you who are joining virtually, you can look up on Prometric's website where your nearest testing center is. You don't have to test at the one closest to you. You can test at any testing center in Florida. So if you want to go to Miami and test and then jump on a cruise ship afterwards, you can do that. It's a whole lot to celebrate. All right, so we have a test application we're going to go through on class 4. We have a skills test. It explains here that you're going to demonstrate 3 clinical skills in front of 2 RN evaluators. They're going to give you a care plan, and you are going to follow it. It's an open book test, guys. They give you a care plan. You get to look at that care plan anytime you want to during the test. So I can be over here working with a patient, can't remember what the care plan said. I can stop and go look at that care plan. You can look at the care plan anytime during the test. It's an open book test. So it's not hard. And then you're going to take a written test, 60 questions, multiple choice, and it's going to cover these things. It's going to cover, do you know how to follow the care plan? It's going to cover, do you know that you do normal? It's going to cover the principles that we're going to go over. It's going to cover patient rights, because it's always about the patient. And it's going to cover observations and reporting. That's what it's going to cover. Everything on that poster. I'm going to get you through that pretty easy. But I have a resource for you. I do a live game show on YouTube twice a month. It's the first and third Tuesday of every month. So next Tuesday, a week from tomorrow, I'll be doing another game show. And it's on YouTube, and it's live. And I put the question up. You have 45 seconds to answer it. And you put in the chat 1, 2, 3, or 4 based on the answer you want to choose. The program that I use grades your answers and puts you on a leaderboard. And I give out prizes. Now, this is nationwide, but I give prizes for the top 3 people. So it's a great way to see the types of questions that'll be on the state exam, gauge how ready you are for the written test, and win some prizes along the way. So it's a lot of fun, and it's a great way to practice for the test rather than just reading a whole bunch of questions and answering them on your own. And people get competitive. Oh, it's a lot of fun. A lot of fun. So remember that you have that available to you. So we have a skills test, 3 clinical skills in front of 2 RN evaluators, and we have the written test, 60 questions, multiple choice, done on the computer. So on testing day, when you go to the testing center, they're very, very strict about this. You cannot take any electronic devices into the testing center with you. So your cell phone needs to stay in your car. If you have a smartwatch like this, it needs to stay in the car. You can't have any electronics in the testing center. Now, if you're getting dropped off and you can't leave your stuff in the car, then you can take it into the testing center. They're going to give you a locker to put it in, to lock it away. But you can't have it with you. You also can't take in study material. So the only things you can take in is your test admission letter, your keys, and 2 forms of ID. One with a picture and one with a signature. The names have to match. Now, in this class, I've got a couple of you that have multiple names. Please, if you have multiple names, please make sure that the 2 IDs that you use have the exact same names on them. So if you've got 4 names and your driver's license only has 3 of them, make sure that whatever else you're using for an ID has the same name as your driver's license. Good? Good. This is the first class I've had multiple of you guys with multiple names. All right, so this is all we can take into the testing center with us. When we go in, they're going to check us in. Now, the check-in process is a little bit long. So they're going to look at you, they're going to ask your name, they're going to check you in, look at your IDs to make sure you're you and you're not testing for your cousin or something like that, right? That has happened. Oh yeah, Miami. Oh, yeah. This woman was getting paid like $500 at a time to go take the test for other people. Yeah, she got caught, but now they're really, really strict on this, right? They got to make sure that you are you. So they'll check you in. And while they're checking you in, they're going to ask you a question. They're going to say, do you have any conditions that would keep you from being a patient for any of these skills? Now, hopefully you're going to say no, go sit down in the waiting room and you'll wait. But if for some reason you got something going on with you, you need to let them know. If you just had oral surgery, you need to let them know that. Because if you have mouth care and you just had oral surgery, I do not want to use you as a patient for her to do her skill on. Okay. If you have a raging case of athlete's foot, right? And you have foot care, well, you're not a good patient for her. Okay. If you are allergic to milk and you get feeding, well, we don't want to use her as your patient because we don't want her to go into anaphylactic shock during the test. Okay. So if you have something, let them know, but don't be difficult. Okay. Nobody likes to have their feet touched. I get it. I get it. Nobody wants to volunteer for mouth care. I get that too. Nobody wants to be fed. I understand, but don't make something up just to get out of being a patient for those skills, because that person still has to test. And if everybody is being difficult, this becomes a problem. And you'll make the evaluators grumpy. So there's going to be 8 people on testing day. So 1, 2, 3, 4, 5, 6, 7, 8. You 8 are here to test today. Okay. And you have foot care. You also have ambulate with a gait belt. And you have feeding. Okay, those are your 3 skills. Now, she's got athlete's foot. She said she sprained her ankle. He's allergic to milk. And with ambulate with a gait belt, I got to find somebody your body size or smaller, right? So I got to look around and try to match you up with somebody, and there's nobody here that fits the criteria for all 3 skills. And oh my gosh, now I've got to juggle, right? You think those evaluators are going to be really happy? It's going to take them 45 minutes to figure out how to put you guys together. And that's going to make them grumpy. Because let me tell you a secret about evaluators. They don't want to be there. They don't. To you, it's a test. To them, it's a job. Right? These are nurses that are out of nursing now. They're like close to retirement, but not quite there yet. Because they still have electric bills to pay. Right? They want to be at home in their pools, drinking their margaritas. They do not want to be here. And the longer you keep them here and out of their pools, the grumpier they get. Oh, yeah. So make it easy for them. Okay. Best thing you can do is to go in, give a flawless performance, not basically put them to sleep, right? Perform well. They won't pay attention to you then. They'll just move along. And then they can go home and get in their pool and drink their margaritas and everybody's happy. Okay. Good. Well, the worst thing you want? Oh, you don't want this. You don't want an evaluator that sits up and goes, huh? Because if they do that, that means they haven't seen what you just did. And that's never a good sign. Okay. So you want to put those evaluators to sleep. So you're going to end up in a waiting room with 7 other strangers. You don't know them. They don't know you. You're not testing with people in this room. You're all testing independently. So you're going to be there with 7 strangers. This is not the time to make friends. Not the time to make friends. Because what ends up happening, remember, you have no study materials and you have no cell phones. So you've got to do old-fashioned talking. Nobody's comfortable with that. You're about to test. So inevitably, this is how the conversation goes. Oh my gosh, I hope I use the right amount of paper towels when I wash my hands. My teacher said that if you don't use 10 paper towels, you're going to fail. And oh my gosh, I got to remember to use the 10 paper towels. And what if I only use 9? And you're going to go, what? My teacher didn't teach me that. And you're going to go, oh, mine said 6. Oh my gosh. So now you guys are all starting to freak out because you don't know how many paper towels you use to wash your hands. Spoiler alert, doesn't matter. Nobody's counting. Nobody cares. But there's a lot of teachers out there. There's a lot of instructors that overcomplicate this to make themselves feel more powerful. If I can make this class super hard, then you're going to think that I'm a genius to teach it to you. I'm the other extreme. I want to make this so simple that you're like, oh God, that was easy. That's it. That's it. That's all I have to learn, right? I want you to be confident going in. I don't want you to be freaking out in the waiting room. But the problem is that there's going to be a lot of people freaking out in the waiting room. And if you all of a sudden decide to be a teacher, hey, I went to Miss Patty's class and that's instant celebrity for you guys, by the way. Yeah, you let them know that because they've all watched me. Every single person in that waiting room has watched me. My videos we're at 35 million views, guys. 130,000 subscribers. I am the #1 channel on YouTube. Everybody watches my videos. So when they find out that you actually sat in this classroom with me, it's instant celebrity status. It's hilarious. But when they find out that you went here, they're going to start asking you questions. This is not the time to teach. You're about to test. And if you give them information and they fail, who are they going to blame? You. Don't make friends. Talk about the weather. Talk about sports. I mean, the Bucks won yesterday. That's awesome, right? You can talk about anything else. You can even talk about politics. I don't care. Do not talk about the test. Now, after you test, tell the world. I live stream this out for free. Anybody can join in and watch this. Anybody. I am trying to teach the world how to be good caregivers because we need to take care of one another. This is my mission. Teach the world, but not on testing day. Okay? When you're in the waiting room, there's going to be 2 rooms off of that waiting room. One of them is the clinical skills room. The other one is the written test room. Now, the clinical skills room is where you're going to do your clinical skills. But notice it's not in the waiting room. You're not doing these skills in front of all these other people. So you 2 would be brought into the clinical skills room. There would be a door with a wall with a door. Everybody else is out here. We go in here and I show you around. I'm going to show you how our privacy curtain works, how the bed works, where the supplies are located, where our patient bathroom is. We're going to do a little mini orientation. And if you can't remember where the supplies are during the test, you can just ask. You're not graded on knowing where to find stuff. You can ask. But I'm going to show you around. And then I'm going to pick one of you guys to go first. So I'll pick on you since you're closer. And the computer is going to randomly select a skill set for you to perform. So, computer, give me a number, 1 to 11. 2. All right, so our computer randomly picks skill set 2 for you to perform. So let's see what skills she has. She has provide mouth care to a resident who has teeth, measure and record respirations, and change position to supported sideline. Those are your 3 skills. You are the patient for her to do these 3 skills on. Okay. So when you're the patient, you are going to get very specific instructions and a script to follow. We don't want you going off script. When you are the patient for somebody else doing their skills, you are going to be pleasant, cooperative, and you. Not a 90-year-old version of you. Okay? If somebody needs to walk you, if that's the skill, ambulate with a gait belt, you're going to walk like you walk. Not, okay? You are going to be you. Pleasant, cooperative, and you. Good? Where those evaluators want to be? At home, in their pool, drinking their margaritas. You start overacting this, you are keeping them from their margaritas. Are they going to be happy with you? Don't overact. Okay, good. Questions? So there's a wall with a door. Everybody else is out here. They cannot see or hear your performance. The only people in this room is your patient, the person doing the skill, and the 2 RN evaluators. There will also be a mannequin in there. We do have a few mannequin skills that we have to learn how to do. So there will be a mannequin in there. I know she's a little creepy, but it's okay. You should see her at Halloween. All right, so everybody good with that? All right, so when you're in that waiting room, those evaluators are asking you questions. They're kind of getting a sense of what skills you have and who the other people that showed up for, because we look at things like body size. We look at things like, believe it or not, slip-on shoes. We look at that. Because if I need to transfer somebody out of bed and into a wheelchair, we have to put shoes on them. Where do those evaluators want to be? At home in their pool. They do not want to be watching you struggle to put somebody's shoes on and tie them. So you would be a great patient for transferring because you've got slip-on shoes. Make sense? Right? So would you. So these are things you guys did not know that I assessed your shoes when you walked in, did you? Right? Nurses assess like they breathe. It is drilled into us. Your evaluators will too. So we got 8 people that showed up for testing today. And after they check you in and get to know you, they're going to separate you into 4 groups of 2 people each. Now notice, this was not just pointing to people and grouping them. This was according to a very specific criteria that they're going to group you in. This takes them about 20 to 30 minutes to put people in groups, and then the test can start. But it's important that you know that, because after they check you in, they disappear for like 15, 20 minutes, sometimes up to a half hour. And you're like, come on, let's start this test. I'm here to test. Where are you? You know, they're putting you guys in groups. All right, so when you go into the testing center, they're going to show you around. They're going to show you how the bed works, how the curtain works, where the bedside table is, where your supplies are located, the patient bathroom, all of that. They're going to go through all of that with you. They're going to pick one of you to go first, and they're going to give you your care plan. Now, we can't even trust that you know how to read this care plan. We are going to read this to you. And then we're going to hand it to you so you have it throughout the entire test. You can go back and look at it anytime you want to. Okay. Now, when we read it and we hand it to you, then the other patient will receive instructions on where they need to be, in a bed, in a chair, covered up, not covered up. So while you're reading that care plan, the evaluator is giving instructions to your patient for that skill. So there's 11 care plan sets. We went over this already. Page 25 will detail each one of them. And I have them in here for you guys to use during practice time. These are the testing care plan sets. Now on mine, this is exactly what it looks like on for the test, except it's not quite so pretty. I make mine pretty, but it's on yellow paper, same words. On mine though, on the back, these are the actual testing checklists. This is actually what those evaluators have in front of them when they're grading you. The exact checklist that you're being graded on. And they're here for you to practice with. So we went over this. Page 24 shows you that each care plan set has an ADL skill, a mobility skill, and a documentation skill. This breaks down which skills are considered ADL skills: bathing, dressing, grooming, feeding. Well, bathing, dressing, grooming, sorry. Mobility skills are anything that requires the patient to move. Range of motion, turning a patient on their side, ambulate, transfer, anything that requires patient to move. And then documentation skill, you are going to get one of these four, guaranteed. Pulse, respirations, feeding, or drainage bag. You will get one of those four. Everybody has to document something on the state exam. So these checklists, what you see on the back here, these checklists are the exact checklists that the evaluators are grading you on, and it includes something called indirect care. Now, indirect care, we're going to go over at the very end of class today for about 2 minutes. Not long. Oops. There we go. So indirect care is going to cover basically how we treat the patient. So anything that you see that has an IC next to the checkpoint, that means it's on the indirect care checklist. What I did is I put them all together. Okay, so if you look at, this is what Prometric has on their website for you guys to see. This is the checklist that they show you. It doesn't have indirect care on it. They're holding stuff back. So what I did is I combined them. So my checklists are more complete than what Prometric gives you on the website. Good. So when you do a step correctly, you get a check mark. Do the next step, you get a check mark. Anything you don't do, no check mark. Anything you do wrong, no check mark. So anything without a check mark is called a deficiency. And that's actually how they're going to evaluate whether you pass the test. They look at your deficiencies. It's not how much you get right. It's what did you get wrong. Now, let me explain why that would be important. Okay. A lot of other tests are graded, how many did you get right? It's not what this is. This is what did you get wrong? Not how many, what. Now, the reason for that is simple. Not all steps are going to be the same level of importance. So let's say that we have to brush this lady's teeth. Is this a safe position for her to be in when we're brushing her teeth? What do you guys think? No, it's really not. She's laying flat. If we pour water in her mouth, that water can go down into her lungs. It's called aspiration, and we could kill her. Oops, sorry. Didn't mean to do that. So this isn't safe. So what would we have to do to prevent that from happening? Sit her up. Yeah, so get her to sit on the side of the bed, get her over to the sink and stand, help her stand. You could put the head of the bed up. There's a lot of different ways to get her safe for mouth care. We probably want to look at that care plan to give us an idea of which method we should be using, right? Make sense? So it's kind of important. How many of you guys have brushed your teeth this month? Awesome. You got some experience. All right. So when you brush your teeth, you probably don't stand like this. You probably stand like this. Why do you stoop forward? Oh yeah, it's gross, isn't it? Man, we get this foamy mess going on. It drips out and you got saliva and yeah, it's definitely not a first date type of thing, right? Don't want anybody to see you with all that stuff, right? You lean forward so all that stuff can drip into the sink. Make sense? Okay. When we put the head of the bed up, that patient is not leaning forward. They're more like this. So where's all that stuff going to go? Yeah, onto them. Yeah, their clothes. So what could we put on them to keep their clothes from getting all toothpaste and salivaed up? Towel. Hey, great idea. Absolutely. So yeah, we want to put the head of the bed up and we want to put a towel over their chest. Those make sense, don't they? Everybody following me? Has anyone ever died from getting toothpaste on their clothes? Not that I'm aware of. Has anyone ever died from aspiration? So which one of those steps do you think might be a little more important? Putting the head of the bed up to prevent aspiration or putting a towel on the chest? What do you guys think? Bed up, absolutely. They're not judged equally. If you forget to put the head of the bed up, that's all you need to forget. And you're going to fail because you killed your patient. They're not going to pass you if you kill your patient. Got it? If you forget to put the towel on, yeah, your patient's going to get a little messy, but they're not going to die. It's okay. So it's not how many you miss. It's what did you miss? Now notice, when I just went through that whole scenario, it wasn't about you. Who were the consequences about? The patient. That is how the test is graded. If you forget to put the head of the bed up, it's not, oh, you forgot to put the head of the bed up. It's the patient has a potential aspiration consequence. If you forget to put the towel over the chest, it's not, oh, you forgot to put the towel on the chest. It's the patient has a potential toothpaste and saliva issue. You guys see that? Okay. So when they're grading, it's not about you and your steps. It's about the patient and the consequences to them. Okay, good. Kind of seeing how this is graded? Okay. So everything without a checkpoint is called a deficiency. My job, hopefully, if I do it right, is that you get no deficiencies on the state exam because you understand how important each one of these steps is. It's a lot to remember, but I'm going to go through it with you step by step. So page 65 explains how the skills grading works, everything that we just went over. So it's basically the notes for the lecture I just gave you. And then you've got a 60-question multiple choice test, and you will have 90 minutes to do those 60 questions. Let's go back an hour. I reminded you that you did 8 questions in how many minutes? 5 minutes. This is plenty of time, guys. You did 8 questions in 5 minutes. You got 90 minutes to do 60. Way more time than you need. People don't generally time out unless you have a language barrier or a reading issue. You're dyslexic, have a reading disability, that type of thing. There is something to help you with that. We'll get into that on class 4 when we talk about test registration. There is something that you can do to help you with that. But generally speaking, you're going to have 90 minutes to do those 60 questions. And for the vast majority of people, time is not going to be an issue. I have a book to help you with this. It's free. You're going to get this in your wrap-up email. It's also on FL-CNA training right next to class 1 for you to download. This is what I call the CNA test coaching ebook. It's a free ebook. It goes through learning how to decipher what they're asking in the question, how to choose the right answer. So it's a good test-taking strategy, but it's specific to the CNA exam. Know your normals, know your role, safety, patient rights, and infection control. Those are the 5 main categories that you're going to be graded on. And you can get it on, let me put it in the chat too. You can get it on foryourcna.com/ebook. I got so much to do to help you guys, to make sure that you have all the resources that you need. So, and remember, when you get your wrap-up email, all of this will be detailed in there for you. All right, so once you've taken the test, you're going to get a test result back. You're going to get one for the written and one for the skills. This is for the written. At the top, it says candidate passed the written test. Congratulations. Good job. Down here, it tells you the categories that were on the test, how many questions were in the category, and how many you got right. I want you to pay attention to this because in healthcare, good enough is not good enough. A lot of people are like, oh, I passed just barely, but I passed. Yay. I'm a CNA now. Do you want that person as a CNA? Do you want a doctor that just barely got out of medical school? You want somebody that knows what they're doing, right? That isn't going to brush your teeth when you're laying flat. Might be important. So, when you get this back, I want you to pay attention to the categories that you did not do well in. And even though you passed, that tells you that you probably need to go back and review that information. Guys, someday I'm going to be the body in the bed. I'm getting older. I am going to be the body in the bed someday. My mother was just the body in the bed 3 weeks ago. She's in the ICU. We didn't know she was going to make it. She went to bed, perfectly fine. Woke up in the middle of the night, not fine. We don't know when we are going to be the body in the bed. What kind of caregiver do you want when you are the body in the bed? That's the kind of caregiver you need to become. So this, even when you pass, is going to matter. It's an opportunity to improve. Then you're going to get one for the skills exam. Again, at the top, it'll tell you whether you passed or not. And then down here, you're going to have a listing of the skills that you do. It'll probably spill over into a 3rd page, but it'll show you the skills that you were assigned to do. And then the final page is going to look like this. This is your feedback. Remember I said everything without a check mark is a deficiency? Your deficiencies are going to be detailed here. This is everything without a check mark on your skills exam. Make sense? Pay attention to this. If it's listed twice, it counted against you. If it's only listed once, 2 fingers. If it's only listed once, it did not count against you. So what does that mean? Why would there be a difference there? Well, remember I said that there are 2 RN evaluators? Remember that? This is actually relatively new within the last 4 or 5 years. They gave us 2 evaluators. And that's because there were a lot of complaints. When we only had 1 evaluator, some people would say, she failed me, but I did that step. I know I did that step. Well, there's no cameras in there. There's no way of proving. So they would just automatically go with whatever the RN said. But they got a lot of those complaints. So they had to figure something out. And what they figured out is if we use 2 RN evaluators, then if somebody misses something, maybe the second one might see it. So if a deficiency shows up twice, that means you did not do it. But if the deficiency only shows up once, that means one of those evaluators was on her phone or not paying attention to you and it did not count against you. Okay, so 2 RN evaluators are actually in your benefit. I'm going to teach you how to do these skills in a way that even if they're looking at the checklist, you'll still get credit for things they may not actually see. We'll talk about that as we go through. Pay attention to this, though. If it shows up twice, that means it's a step you missed. You probably want to pay attention to it. We're going to break here and take our break. Let me write this down. take our break. We're going to come back in 15 minutes. So that's going to be at 11:20. We'll come back. And if you need to go get a drink or anything, please feel free to do so. We are still live. Keep that in mind. Okay. Audio is still live. Your countdown is on the screen. Yes, absolutely. Yeah, anybody is free to come and go as they need to. Bathroom is just beyond the archway on the right. There's another bathroom in the retail store if you need that one. Just go all the way to the back of the store, take a right for a store on the right. Thank you. Okay. Anybody have any questions before we go back into teaching? Any question? Am I going too fast for anybody? Everybody following along pretty well? Good morning, Marie. Okay. So I told you I've been doing this a very long time, and the program is not the same it was when I first started. It's evolved. One of the ways that it evolved was my first class was horrible. Horrible. And the problem was, the reason was that as an RN, I mean, RNs can teach CNAs, right? I thought I knew everything I needed to know to teach a CNA class. You just teach them what you learned. But the problem is that CNAs are not mini nurses. That's not your role. Your role is to follow the care. Well, I didn't know that then. No idea. And I did what all the other RN instructors out there do. I focused on anatomy and physiology and medical terminology and medical abbreviations and military time and all this technical stuff. And yeah, showed them the skills, but that was like a byproduct. And I realized that my students weren't doing all that great on the test. So after a couple classes, I thought, well, maybe I should kind of get to know the test a little bit so I can figure out what's on the test so I could better prepare my students. It sounded like a good idea. And that led me into a huge research project with prometric testing. And when I say I dove deep, I dove deep. And because of that, comparing all of the different checklists and what's required and what different words mean, because even the words in the checklist matter. When I started to really kind of get to the heart of this, I noticed a few things. And one of the things that I noticed is that on every single checklist, didn't matter what the skill was, number one was always the same. Didn't matter what the skill was. Checklist item number one was always the same. And it was, did the candidate, that's you, you're always the candidate, greet the resident, address by name, and introduce self. So they're asking, did you do that? And as okay, that's the first step on everything. I can work with that. And then I noticed that step two was also the same. Every checklist. Step two was the same. Provide explanations to resident about care before beginning and during care. So what does this mean? Well, this means that you have to treat the patient like a person, and you got to tell them what you're doing. Two very important steps. And that's for every single skill. And I thought, I wonder if there's other things that are the same for every skill. So I kept looking. And I realized at the end of the skill, a lot of those points were the same. So every skill has to start the same, and every skill has to end the same. So this created the principles. And this is where I started, was how do we begin every skill? This is how I created all of those things on the back wall. So every skill is going to start the same way with something we call the opening. Now, the opening has very specific steps associated with it, and it's with every skill. Doesn't matter what we're doing. Now, the problem is that you guys are all going to sit there and nod your head and listen to me, and then when you get up to practice, you skip it. You don't do I don't know why, but you just skip it. So let's go back here real quick. Every single checklist has these steps on it. So when you're practicing, you should not be skipping the opening. This is part of the skill. It's not something you tack onto the skill. It is the skill. Do you guys understand that? Okay. So when you're practicing, you need to be practicing from beginning to end with all of these steps. Because you know what's going to happen during the state exam when you get in there and you get all nervous and you're all flustered? If you didn't make this part of the skill, you won't perform it on the state exam. You will perform like you practice. Good? This was a heartbreaking situation for me. We had a student, let's take these. We had a student who many years ago, probably, I don't know, 10 years ago now, she was really good. She was in here all the time practicing. I mean, she was really, really good, very conscientious, very dedicated. I knew that she was going to pass, no problem. I had no doubts at all about her level of ability, none. She went to the test. She came directly from the test crying. I failed. Oh my gosh, how did you fail? You were doing so well. What happened? And she says, well, I didn't wear gloves with mouth care. And I said, why wouldn't you wear gloves with mouth care? She said, because when we were practicing, I never put them on. And it didn't trigger. I didn't think about gloves during mouth care. How you practice is how you will perform. That was an expensive lesson for her because she had to pay to retake the skills part of the test. So that's why I was heartbroken for her. That was horrible. I mean, that deals a blow to your self-esteem. It really does. So I felt horrible for her. But that's why I take the time to remind you that this has to be practiced with the skill. Because if you don't use the supplies like you're supposed to, if you don't do the opening and the closing like you're supposed to, when you go test, you're not going to do it then either. And you'll fail. And I don't know about you, but I don't have extra money to just throw at a test. Just don't need this $105. Here, the test can have it. Okay. Money's tight. Money's tight everywhere. So make sure you're practicing properly. So the opening has very specific steps to it. And we're going to go through each one of these steps to learn the opening. It is a principle that we're learning. Remember, there are 11 principles that we have to learn. We've already learned one, the skill rules. We follow the care plan, the whole care plan, and nothing but the care plan. We perform the skill as directed on the care plan. And then while we're doing those skills, we make observations. And who do we report those to? The nurse. That is skill rules. You guys now know skill rules. So we're going to learn the opening as well. So as I was doing this research project, trying to figure all of this out and figure out how to teach you guys all of these steps, I started to realize that this is how the principles were born, that there are things that are repeated over and over and over again. But when I did this really kind of made it make sense to me, right? So this is range of motion to elbow and wrist. Super easy skill. We'll learn it along the way. These are all the steps on range of motion, elbow and wrist. But what I want you to pay attention to is how much green is on there. You guys see all that green? The green is the opening. So every step that's green on there means that it's a check mark that's going to be accomplished with the opening. There's also a lot of red on there. You see all that red? That is a check mark that will be checked off when you do the closing, all the steps of the closing. Now, if you look at this, half of those check marks, half of this checklist is red and green. We haven't even got to the skill yet. Half of this checklist is the opening and the closing. Do you guys see how important this is? If you're not doing the opening and the closing, it doesn't matter how good of a job you do on the rest of it, you only got a 50%. It's important. But it's not just this one. Look at that one. Look at that one. Look at that one. A lot of red and greens in there. Starting to get it? The opening and the closing are super important. So we're going to spend a lot of time on them because they apply to every skill we do. So let me go back here. When we get our care plan that has our 3 skills on it for the test, we're going to follow the care plan exactly. So whatever the first skill is, we're going to do that first. Whatever the second skill is, we're going to do that second. Whatever the third skill is, we're going to do that. Wake up, guys. We're going to do a third, right, last. Absolutely. So we're going to follow that care plan. The evaluators are going to use these checklists to check off our performance. So we have to know what these checklists are so that we can perform properly. Now, the problem is that when you look at this, this is written for an RN. It's not written for you. It's written for an RN. So what I had to do is take this checklist, filter it through an RN brain, and come up with something that I could give you as a student to follow that would get all of those check marks in. Okay? So that's what these principles are all about. So the principles are the checklist filtered through an RN brain and put as a principle for you guys to follow. I made it easy. Remember, I'm all about easy, right? So each one of these corresponds to something on that checklist. So you can't skip anything. This is part of what we call the Big Four. There are 4 principles that are going to govern every skill we do. Skill rules is one of them because we have to follow the care plan. Then we're going to do the opening, and we're going to do the closing at the end. And we also have to evaluate if the patient needs gloves. So those 4 principles are with every single skill we learn to do. So we're going to start there. We're going to learn these 4 principles before we start learning skills, because these are part of every skill. Good? Okay. So you can see all of the principles here on page 27. It's everything we have on the back wall. All of those principles are on page 27, and we're going to go through them all one at a time. All of those principles are designed to keep us safely within our scope of practice and protecting resident rights, which we'll talk about along the way. Now, these principles are in our flashcards. You guys can make your own. It's a whole lot cheaper. Make your own. These have the steps for every skill, the supplies for every skill, and the principles, all 11 that are on that back wall in a little carrying case. And for you guys, until you graduate, they're $14.99. Online, they're $24.99. So I'm giving you guys a huge break, or you can make them yourself for free. So let's go to page 21 and talk about the patient for a few minutes before I get into how to do the opening. Anybody ever been sick? Anybody ever been sick? Yeah? Where do you want to be when you're sick? Home. Yeah, my place, my bed, my TV. I want to be laying on my couch. I do not want to be at work, at the beach, at a friend's house. I want to be home. Where do you think your patients want to be when they're sick and they're not there? What do you think that's going to do to their mood? Oh, grumpy. Absolutely. So first of all, you're grumpy because you're sick. Now you're grumpy because you're sick and you can't be home. Starting to get that? Okay. Now, the one thing you need when you're sick is rest. Everybody knows this. When you're sick, you need rest. Do you know where the very worst place in the world to try to get rest is? A hospital. Somebody is in and out of that room every 17 minutes on average. How in the world are they going to get a good solid 8 if they're being interrupted every 17 minutes on average? It's a problem, right? Pretty big problem, actually. So, I have a whole lesson I'm going to do on this online, but this is just a little quick sneak peek here. This is one of the reasons that they're trying to move to a new model in the hospital where the people that work with the patients have more tasks to do. So like CNAs might be trained to do EKGs and take blood because they're trying to minimize all of those interruptions of the patient. So if you go in as a CNA and you can do all of those things, you'll get them all done. And now we don't have multiple people going in and out of that patient's room interrupting their sleep. Make sense? So in hospitals, you might be trained to do additional tasks just to try to minimize that interruption with the patient. So we've got a patient who is sick, so they're grumpy. They're not home, so they're really grumpy. And they're sleep deprived, right? They're not getting a good solid 8. So what does that do to our mood? You ever been sleep deprived? Does that make us happy and sunny and cheerful disposition? All right, so we got the deck stacked against us. Our patients are not going to be pleasant people. If you have a nice patient, that is a bonus. Good for you. That is a great day, but that is not going to happen very often. We need to set the right expectations here. Your patients are not going to be nice. Don't expect them to be nice. The maddest I ever got at a CNA was a CNA who told me, well, she started it. Excuse me? She can act any way she wants to. She is sick. She needs help. She is in a place to get help. She is not home. She has no expectation of being civil. You are being paid to do this job. The expectation for civility is on you. Do you guys get that? Do not expect your patients to be nice. If they are, great. Now, I've got a pretty good track record of making my patients nice because I am nice. Okay? The nicer you are, the nicer they'll be. Good? I call it the bucket of nice. You're born with a bucket of nice. You got a full bucket of nice when you're born, right? But over your life, you start giving some of it out. You smile at somebody. You hold a door open for somebody. You're considerate and kind, and you give all of your nice away. But if nobody's refilling your bucket, what's going to happen to it? It's going to go empty. Yeah. If nobody's refilling your bucket of nice, it's going to go empty. Now you got no nice to give, and that makes you nasty. So when I've got a patient who is nasty, I know their bucket of nice is empty. How do we refill it? We be nice to them. We give them nice to work with. So the nastier a patient is, the more in need of nice they are. Does that make sense? But that's not how we react, is it? Oh, you want to catch an attitude up in here? Bring it. Right? That's how we react. Try me. You know? But that's not what the patient needs, is it? If the patient isn't nice, that means that they've run out. It's up to us to refill. But that's not the only thing going on with that patient, right? They're stuck here and they're worried about what's happening there. Like, who's feeding my cat? Or what is my significant other doing? Right? Who's taking my kids to school? Right? They got things going on in their mind that have nothing to do with this. And then they've got things going on in their mind that has everything to do with this, because patients in a hospital are all dying. Just ask them, they'll tell you. Patients in the hospital feel like they're dying. Otherwise, they'd be at home. And they start to get consumed with thoughts like, what is wrong with me? What does this mean? Am I going to survive this? What is this going to happen to what's going to happen to my work? What's going to happen to my home life because of this? How am I going to pay this bill? Right? All of those things are going through your patient's mind. They are seriously self-absorbed. Now, do you think in that environment, when you've got somebody that's grumpy, grouchy, sleep deprived, worrying, and a little absent-minded because they're thinking about other things, do you really think they're going to take in everything you say to them? And yet we expect them to. I already told you they're coming to get you to take you to X-ray, right? We're the one that cops the attitude with them, not thinking about their frame of reference. Is it about us? I told you this is my hardest job, is to get you to start thinking about things from that patient point of view. Okay? So this is bad, right? This is not an ideal scenario. When you've got these patients that are all wonky, right? Not ideal. Now, we got one more thing to throw in there, and that's you are a stranger. Now, this is where we really mess up. So, like we messed up earlier, but this is where we really mess up. Because to us, once we start working, it becomes routine, habit. How many of you guys work now? Okay. How many of you guys go in with the same level of enthusiasm that you had on day one? Oh, I'm not seeing any hands. What happened? Why do you not have the same level of enthusiasm now that you had on day one? It became routine. You're just there hitting the time clock, putting your time in, doing the bare minimum until you can hit that time clock again and get out, right? This is now a job, and you treat it like a job. Do you think this patient wants to be treated like a job? And yet that's the trap that we fall into, because we start treating it like a job, just like you all do now in your current employment. But the problem is that this is a human with specific needs that they can't meet on their own. They don't want to ask you to help them with tasks. They'd rather do them themselves. I guarantee it, but they can't. So when we treat this patient like a job and we give them that attitude and we teach them that we really don't want to be here, we don't want to be doing this, it sets this dynamic up for a lot of resentment. And now your patient is on the call light every 5 minutes because their emotional needs are not being met. Do you guys see that? If you want to cut down on your call lights, make your humans the center of your attention. Good? Makes sense? Okay. So we talked about the patients now. Let's talk about the place. So this is something that you may not have really thought about. Maybe you have. I just came off of 3 weeks off of class. So my last class ended 3 weeks ago. I've had 3 weeks, and now I've got you guys, right? So I had a 3-week break. Awesome. But during that 3 weeks, I really wasn't off because I had lots and lots and lots and lots of work to catch up on. Lots. I have been sitting at my, you can tell, I have been sitting at my computer for on average 12 to 14 hours a day. Everything that you see, I do. Every graphic, I made. Every animated video, I create. I draw all of those assets. All of these, I made. The website, I do that. I code my own website. The online course, I created everything in there. Every question I ever give, I write. Pretty busy. I want a break. I really do. But I can't call up my local hospital and say, okay, listen up. I've been working a little too hard. I'd like to reserve a room for 3 days, please. Corner room, 2 windows would be nice. No roommates. How far do you think I'm going to get? Yeah. We don't take reservations here. You can't like call up and get into the hospital. How do you get a room in a hospital? How do you get that? Anybody know? Anybody ever been a patient at a hospital? How do you get a room? What's that? Okay, yeah, luck's going to play into it because they're pretty full right now. Yeah, what department do you have to go to usually get into the hospital? Emergency. Now, emergency's job, they have one job, and it's not what you think. It's not to save your life. That is not the job of the emergency department. They have one job. That is to send you home, to keep you from being admitted. That is their job. 100%. That is their job, to keep you, to stabilize you, and send you away. So if you actually get a bed in this facility, you are really, really sick. I mean, you like earned that bed. Okay. So are these people here by choice? No. Keep that in mind. Okay. So that means that we took the sickest people in our community and put them all in one building, all of them. And do you know what they all brought with them? Pathogens. Their own unique pathogens. Now, we don't put them one to a room. Oh, no, no, no. We put them two to a room. So those pathogens can get to know one another. Now, this is a problem because this patient is currently fighting something else, whatever brought them in. Illness, injury, infection, they are fighting something. That means their immune system currently pretty busy. So if we take pathogens from that patient and give them to this patient, they will not have the resources to fight a two-front war. Now, this patient isn't going over into that bed. How do you think pathogens get from one patient to another? They're not commingling. How do pathogens move from one patient to another if the patients aren't moving around? Yeah, us. We go over, touch patient 1, don't pay attention to infection control, and touch patient 2. And now we have transferred pathogens from one patient to another. Now, this sounds very far-fetched and very sci-fi-y, right? This never happens, does it? 1 out of every 25 patients in a hospital comes down with something they did not come in with. 1 out of 25. So how many of you guys ride a roller coaster? Anybody ever ride a roller coaster? Okay, if I told you the next roller coaster you were going to get on, one of those seats, yeah, the bar is going to fail and you're going to fall out and die. Sorry. How many of you guys are getting on that roller coaster? Hey, you could get a seat that is just fine. You know, there's 24 of those. Just one that doesn't work. How many of you guys are getting on that roller coaster? That is exactly what your patients are doing right now every time they get admitted. They are getting on a roller coaster and that one seat does not work. That's scary. That is scary. And that is 100% our responsibility. Now, why am I preaching on this? Because CNAs spend more time with patients than any other healthcare worker. And even worse, we are the ones helping them with all of that personal care. which means that we're all up in all of their holes, which is where pathogens are going to enter. So do you see that this might be a problem? Okay. So the settings that we work in are pathogen paradise. This isn't a risk to you. It is a risk to your patients. We're going to have a huge lesson on this on Wednesday. Okay. Good. The other thing I want you to remember is that not all patients are the same. Sure, we might have on our unit 4 diabetics. They are not all the same. And we can't treat them all the same. They have differences. So when we're looking at care plans, we can't just think, oh, this is a diabetic patient. I already know what's on the care plan. I don't have to worry about it. I'm not going to read it. I'll just do what I do for all diabetic patients. That may not work for this one. Patients are individual. If it did work, we wouldn't need care plans. Okay. Oh, that's good, Melissa. So Melissa says, you are so right, Miss Patty. I'm caring for an Alzheimer's patient and they were really out of nice. So I had to fill the nice back into her. Yep, absolutely. Absolutely. Thank you for that. All right. So remember that your patients are all going to be different, just like every one of you are different. And I don't know why healthcare, and gosh, nurses are like the worst at this, right? So how many of you guys are exactly like the person sitting next to you? 100%, exactly like them. No? No? Then why do we expect all of our patients to be exactly alike? I know I'm unique, but for some reason I can't figure out that you are. Okay, remember that. Every patient is unique. What works for one may not work for another. So on the test, you might make a mistake. It's possible. You might make a mistake. If you make a mistake on the test before you end your skill, though, you can correct that mistake. You can say, correction, I would have whatever it is that you needed to correct. But once you end that skill, it's kind of like a red button on a game show. Bzz, you're done. Final answer. So take your time before you say your skill is done. Take your time. Think about your skill. Go back and read that care plan one more time. Make sure that you got everything on that care plan so that we can make sure that we're getting the best score possible on the exam. Page 33 talks about how to make corrections. It's pretty simple. Just say what you would do. Now, some things they are going to need to see. So remember I said that we have to do our opening, right? But a lot of students skip the opening. They get to the test, they do their skill, but they forgot to do the opening. I can't say, correction, I would have done the opening. Yeah, they kind of need to see that. They need to hear what you're saying to the patient. They need to see the order that you do those things. So you can't just say, yeah, I would have done the opening. You actually have, they're going to make you go through the steps. So some things they'll tell you, I need to see that. Other things you're able to correct verbally. Take your cues from the evaluator. They'll let you know what they need to see. Okay. It's always a good idea to reread that care plan before you end your skill, just to make sure that you got everything that you needed to get. And most of the time you actually have to perform the steps. But I'll give you an example of some time that you wouldn't have to perform the test or the skill for the test. So let's say that we're doing mouth care. Now, one of the steps is you have to wet the toothbrush before you put the toothpaste on it. That lets the toothpaste spread around a little better. Otherwise, it gets all gloppy and doesn't really spread very well. So let's say during the test, you know this, right? You've heard me say it. But you get into the test and you totally flake out and you don't wet the toothbrush before you put toothpaste on it. And you brush and you let them rinse and you dry them off and you clean the basin and you put it away and you do your closing and you think about it and you're like, oh no, I forgot. Now, you could just say, correction, I would have wet the toothbrush before I put toothpaste on it. They're not going to make you repeat everything. So some things they will need to see. Some things you can correct verbally. You couldn't say, oh, I would have brushed your teeth. All right, so let's figure out how we're going to get through this class, and then we're going to learn the opening. So you have a syllabus in front of you. It looks like this. This is your syllabus. It's what's on the screen. This is our roadmap. It explains how we're going to get from point A to point B in 4 weeks. Those of you who are joining us online virtually, you can get a copy of this syllabus on flcnatraining.com. It's at the very top of the page. So when you're looking at the syllabus, it's arranged in columns and in rows. So if you look, this is class 1 Monday. That's where we are. This section is skills, what we're actually going to learn in class. So we learned skill rules. Good job. And we still have a long way to go in the last hour. We still have a whole lot left to learn. I'm not done yet. The second column is going to tell you the lessons that we're going to go over in that class session. So we learned about the CNA exam. So you can check that off. We learned about delegation and liability. We learned about the differences in patients. We learned about the testing care plans. And we learned how we're going to use all of these principles and the page that you can see all of the principles on. So all of that we've already done. Yay. Third column is your dreaded homework. So tonight you're going to go home and read chapter 1 in the yellow book. And you're going to take a test in the white book to prove that you read the yellow book. That test is going to be on page 181 of your white book, and the answer key is the very last page. We'll go over that again at the end of class. Don't worry about it. But you can see where your homework is in that column. Now, the last column are things I hope we'll get to, but we may not. So if you read something in that last column, you're like, it doesn't sound familiar. I don't think we did that one. Read that lesson. Because sometimes I get going and I run out of time. Okay. Every class is a little different with me. Just a little bit. All right. You can see the same thing for class 2 Wednesday, all the way across class 3, class 4, and so on, all the way down. And it explains how we're going to get through this lesson. Now, if you can't come to class for whatever reason, you would want to look at the things for the class that you're missing. If you're not joining the live stream or watching the replay, you would want to watch these videos on your own to get and read the lessons to get a sense of what you missed. Good? Questions? So we've gone through almost everything here. We went through the 5 key phrases. That's this guy. We did the care plan activity together. We learned about corrections, and we learned skills grading. We will go over warm, dark, moist in a minute. All right. So this is your homework book, the yellow book. Please don't write in this book. You're going to return this book to me on the last day of class. Do not write in the yellow book. You just use it for homework. So take it home, leave it home. You don't need to bring it back and forth to class. We don't work out of this book. I don't like this book. I'll be very honest with you. It's written at a 6th grade level. The words are small. The writing is big. Lots of pictures. It's not hard to get through. Plain English. But there's a couple of things that I don't like about it. So in that yellow book, go to the very back in the index. Now, how important is the care plan for CNAs? How important? On a scale of 1 to 10, how important is care plan? Yeah, about 1,000. Absolutely. Now, in the index, look up care plan. So we would expect a whole lot in this book about the care plan, wouldn't we? So how many pages is the care plan on in this yellow book? Oh my goodness. Well, wait a minute. That can't be right because the care plan dictates everything that we do, and it's only mentioned twice in this book. This is why I don't like the book. Okay. So when you're reading this book, keep in mind the things that I'm telling you. It's a good book for basic knowledge. I'll let you read it because it does go over some things I'm not going to. But keep in mind that it does have its limitations as well. If I contradict the yellow book, always go by what I say. Okay, good? Good, okay. I am trying to write another book to replace this. Yes, because I have so much free time. Right now I'm in question writing mode. I'm adding a graded quiz to every single lesson in my online course. There's 118 lessons in there, and I'm writing a quiz for every single one of those lessons. So right now I'm like questioning my life. That's what we call it. But that's just another step toward me being able to get rid of this book. So I am marching in that direction. All right. But don't write in that one. So you're going to read chapter 1 in the yellow book, and then you're going to go to my book, the white book, page 181, and there's 20 questions there for you. So you answer those questions. Let me warn you, don't fall into this trap. Some of you guys are going to go straight to this quiz, take it, pass it, and not do your reading. Some of you guys will do that. You're shortcutting. The problem is that you don't know what you don't know. Quiz proves what you do. You don't know what you don't know your gaps. You have no idea where your learning gaps are. If you don't do the reading, you still won't know where your learning gaps are. So even though you might be able to answer these questions all by yourself without doing the reading, still do the reading, because the reading might fill in a gap that you have that you don't even know that you have. Good? A lot of people shortcut this. So you're going to grade it on page 201. So do the reading in the yellow book, take the quiz on page 181 of the white book, and then grade it. When you come to class on Wednesday, I'm going to go write down my little list here, and I'm going to ask you how you did on the quiz. So at the bottom of the page here, right here, it'll tell you if you got 0 wrong, you got 100%. Well, that makes sense. If you got 1 wrong, you got a 95%. 2 is a 90. Figure out your score, and then when I call your name, tell me your score. If you didn't figure out your score, tell me how many you got wrong, and I'll do it for you. But on the front of your yellow book is a Y and a number. When I call your name, tell me what your book number is. This is how I keep track of my books. Ada. Okay, why 18? If I call you something different than what you want to be called, like if you have a nickname, let me know and I'll write it down. Zumerinda, what's the book number? 17. Y17. Okay. Elvira? 9. Thank you. Robin? Thank you. Samantha? 4-6. Thank you. Janiyah? Thank you. Wow. You guys are all sitting together. Catherine? Thank you. Jihu? Y12. Thank you. Paula? Y10. Thank you. Kaylee? Y4. Thank you. Brianna? Y15. Thank you. Luz? Kiara? Cheyenne? Tamika? Jody? Abigail? Thank you. Hey, I always forget to do that part. Okay. All right, so let's learn how to use this study guide. So when we're looking at a principles page or a skills page, at the top you'll have the title, you'll have the skill-specific steps, and then here you'll have your principles all laid out for you. And we're going to learn these as we go. This is just kind of an overview of how this is all set up. Short version of the skill here, video, and test-specific information. So if you're looking down here, you'll see that somebody with your level of experience should be able to do this skill in 5 minutes or less. This tells you it's going to be done on another testing student, but sometimes we do this on mannequins. This should be going here. Hold on. I keep forgetting to do this. So video, here we have test specific information. Sometimes you'll see it, a mannequin there. That means that skill is going to be done on a mannequin. Now, this is important when you're in here practicing. If this is going to be done on a live patient during the test, you need to be practicing on a live patient. If it's going to be done on a mannequin during the test, you need to be practicing on the mannequin. So when you're practicing, make sure you pay attention to this so you can set this up just like it's going to be for the state exam. Sometimes you'll see a chair there. Sometimes you'll see a bed. You'll want to get that person that you're practicing on in the right position, chair or bed. And then over here, it'll tell you whether charting is required. On the skills page, so if you go to page 53, it shows you how a skills page is going to be laid out. At the top, you'll see a care plan. What do we do with a care plan? Follow it. You'll see some knowledge questions here to make sure that you got the information that you needed to get from that lesson. Step-by-step instructions on how to perform the skill, the documentation sheet that's used in the testing, and supplies. So it's kind of a one-page overview of the entire skill. Good? Make sense? So I want to talk to you about the step-by-step instructions here. I am exceedingly detailed. Remember I said that I took these, filtered them through an RN brain, and spit them out for you guys to follow, right? I am detailed. And let me explain to you what I mean by that. How many steps are involved in a sandwich? If you were to make a peanut butter and jelly sandwich, how many steps does it take? Give me some guesses. 2, 5. Any others? Any others? Peanut butter and jelly, it's not hard, right? 6-year-old can make it. They'll make a mess, but they can make it. Yeah. There's actually 42 steps. Now, we're not doing anything crazy. We're not toasting the bread. We're not cutting it in little triangle. We're not doing anything crazy. That's just a basic peanut butter and jelly sandwich. 42 steps. If you had somebody that didn't know anything about making a peanut butter jelly sandwich, they need all 42 steps. Because in order to make a peanut butter and jelly sandwich, first we need bread. So we need to get the bread. Now, we're not going to pretend it's in a cabinet or a pantry. It's just on the counter. We'll make this easy, right? We got bread on the counter, but it's in a wrapper with that twist tie thing on it. So we have to undo the twist tie, open the wrapper, and get 2 slices of bread. Then we got to do the spinny thing to put the twist tie back on. Now you're holding 2 pieces of bread. Where do you want to put it? Plate. So we got to open the cabinet, get a plate, close the cabinet, put the bread on the plate. Now what do you need? Knife. That's in the drawer. So we're going to open the drawer, get the knife, close the drawer, put the knife on the plate. Now what do we need? Peanut butter. That's in a pantry or a cabinet. You got to open the door, get the peanut butter, close the door, put it on the counter, and unscrew the lid and put it on the counter as well. Now we need jelly. That's in the fridge. So we open the fridge, we get the jelly, we close the fridge, put it on the counter, and unscrew the lid. Now you pick up your knife, get some peanut butter, smear it on the bread, wipe it off on the other bread, right? Put your knife in the jar to get the jelly, smear that on the bread, put the knife in the sink, put the lid back on the peanut butter, open the cabinet, put the peanut butter back in the cabinet, close the cabinet, put the lid back on the jelly, open the fridge, put the jelly back, close the fridge. And now you can put those 2 pieces together and eat your peanut butter and jelly sandwich. 42 steps, people. I didn't make up the rules. So if I can make a peanut butter and jelly sandwich, which we've already decided a 6-year-old can do in 42 steps, just imagine what I can do with a partial bed bath. So when you're looking at the steps on the page, I don't want you to focus on the number. I don't want you to see this and go, oh my gosh, there's 19 steps here that I have to remember how to do. Oh, I'm never going to get all this. I don't want you to think it's all easier. Nothing that we're going to learn here is more than 42 steps. It is all easier than making a peanut butter and jelly sandwich. Everything we're going to learn in here, easier than making a peanut butter and jelly sandwich. Don't get wrapped up in the steps. But I need these steps to teach you exactly what to do. There is nothing left out. You can take this right now, go to the testing center, if they let you keep this with you, and follow each one of these steps exactly as it's written, and you would get 100% on that test. 100%, without knowing anything else, without having any other knowledge. If you just followed these steps exactly how they're written, it's 100%. So you now have everything you need to pass the state exam. But I want to teach it to you so that you don't have to rely on this paper. Good? We're not going to memorize. We're going to learn. Okay? Am I going too fast? Okay. So remember, there's 3 groups of skills. There's ADL skills, there's mobility skills, and there's documentation skills, and you're going to get 1 out of each group when you test. So we have the care plan at the top of the page, supplies at the bottom of the page, step-by-step instructions that come straight from your checklists, and practice questions as well. So this is the course. All of you guys are going to have access to this at the end of class today. It's on courses.foryourcna.com, but you're going to get an email. You're just going to click the link to go here. You'll probably want to bookmark it to make it easy to get into. All of you guys already have a login. You created it when you registered for the class. Okay, good. That's why I have you do the online registration so that I can put you in here quickly. So all of you guys will have access to this at the end of class today. So one of the things that you're going to see in there is a lesson that goes along with the opening. And it's going to show you exactly all the steps that are involved. It covers it very well. It also has an interactive activity that you can do that we're going to do together in here so I can show you how this works. But here are your steps of the opening. First thing we have to do is knock. Now, that seems like such a trivial step. A lot of people try to skip it. They don't think it's all that important. Let me explain to you why that knock is way more important than you think it is. Remember that patient? You know, that grumpy, self-absorbed, sleep-deprived patient? Well, they're laying in bed, and they're trying desperately to get a little bit of sleep. So I want you to imagine for a second, you are in that healthcare setting. You've just managed to nod off, and you hear a noise, and your eyes pop open, and there's a complete stranger standing over you with a sharp object in their hand. How are you going to react? Well, I'm certainly not going back to sleep, right? That space that your patient occupies has to be a safe space for them. Has to be safe. When you invade that space with little to no warning, it takes that safety out of the space. So knocking is way more important than you think it is. That knocking is a barrier that prevents intrusion into their safe space. They have to have control by saying, come in. Does that make sense? That knock, way more important than you think it is. Way more important. But once we've knocked, and for the test, your patient's going to say, come in, or they may not say anything at all. It's considered an open door policy for the test. So like if, you know, the door is open, you would just kind of a courtesy knock and come in. If that door is closed in a clinical setting, don't just barge in there. That is not your room. That is the patient's room. They're paying for that room. Don't barge in. Super important. We need to knock and wait. If you just barge in, there are some things in life you cannot unsee. I want you to think about that. And there are some things that are very unpleasant to not be able to unsee. If the door is closed, knock and wait. If you don't hear anything after a couple seconds, I would knock again, louder. If I still don't hear anything, I'm cracking the door and I'm going to say, hey, it's Patty, the nurse. Are you okay in here? If I don't hear anything, then I'm coming in because there's a problem. Okay, but I'm going to give them those levels of privacy up until that point. I'm not just going to open the door and barge in and go, hey, it's Patty. Doesn't mean anything. Make sense? Good? Okay, so once we've knocked, we're going to enter and greet the resident. When we greet the resident and address them by name, it does two things. Number one, it assures them that we see them as human. That's way more important than you think it is. That patient has to know we see them as a human, not as a body. There's a big difference. The second is we have to greet them by name because they have to know that we have the right person. So for the test, there's no ID bands. You're not going to check an ID band. And that's because in most settings yes, there's ID bands in the hospital. That's pretty much it. Where you live, your home, where you live, do you guys have ID bands when you go home? How in the world do those people in there know who you are if you're not wearing an ID band? How do those other people that are in that building with you know who you are? They know who you are because they got to know you. That's your husband, your child, your sister, your mom, your dad. They know you. They don't need an ID band to identify you. Where patients live, they are not going to have ID bands. Just like you don't have ID bands where you live. So patients in nursing homes, it's where they live. They are not going to have ID bands. Patients in assisted living, it's where they live. They're not going to have ID bands. Patients in home care, it's where they live. So you're not going to have ID bands in every setting. It's much, much better to address them by name. How many guys have ever gone to the doctor? Do they give you an ID band when you go to the doctor? No, they just take your height, weight, put you in a room. They put a folder on the outside of the door. When the doctor or nurse practitioner comes in, they have a folder. And they look at you. Now, what's your name? Tamika. This is Tamika. Say hi, Tamika. Hi, Tamika. We know this is Tamika. So if I walked in and I said, hey, Jessica, how are you today? What's her name? Tamika. What is she going to say if I walk in and say, hi, Jessica, how are you today? What are you going to tell me? Yeah, I'm not Jessica. Do you want what I've got in store for Jessica? Probably not. You are able to self-identify. If somebody calls you the wrong name, you will correct them. Guess what? Your patients, for the most part, have that same ability. Now, if they don't, if they have dementia, I would discover that during my head-to-toe assessment because I look for real problems and potential problems. And I would already have on the care plan how we're going to identify this patient because of that deficiency. So there's already a process in place for this. So for the test, our patients, remember, are pleasant, cooperative, and themselves. All of you have the ability to self-identify. So you are going to be addressed by name. Now for the test, we're going to use Mr. and Mrs. Jones. We use one name, makes it super easy. So everybody in here is now Mrs. and Mr. Jones, okay? But they're going to address you by name. Good? Make sense? Once we've greeted and addressed by name, then we have to introduce ourselves. Now, I'm not going to just walk in and say, hey, I'm Patty. That means nothing to anybody. Nothing. I could be Patty that brings the cookies. I like that, Patty. I could be Patty that brings the needles. No, so much. Right? So just saying your name doesn't really help. What they need is your name and title. Hi, I'm Patty, your CNA today. Good? Good. Now, I've been teaching this a long time, and when I was still working in the field, because I teach this all the time, I was saying, I'm Patty, your CNA. No, I mean, your nurse today. I was getting it. My patients were really confused. So make sure you're using the right title. After you've introduced yourself, now I like to ask my patients, how are you today? How are things going? I like to do something nice, because if they're not having a good day, that's an observation that needs to be reported to the nurse. But it also might affect my ability to do whatever skill I'm there for. If I'm supposed to walk you and I walk in and I say, hi, Miss Jones, my name is Patty. I'm your CNA today. How are you? And you say, oh, I'm dizzy. I'm nauseous. I feel horrible. Well, I'm not going through the rest of this. I'm going to stop there and say, oh, let me go get your nurse for you. Hold on. And I'm going to go find a nurse and say she's dizzy and nauseous and feels horrible, and not my problem. Okay. So I like to find out how my patients are. Once I do that, I need permission. Patients have the right to say no. Patients can say no to anything at any time for any reason. And if they say no, no means no. We take our hands off of them. Period. No means no. I don't care if you're halfway through a skill. If your patient says no, you need to be hands off. Just because they're in our setting doesn't mean they've given up their rights. Like, I can't come over there and grab you just because I want to, even though you're in my classroom. Right? Setting doesn't matter. All right. Once I've obtained permission, I'm going to close the curtain. Now, let's talk about that curtain for a second. Ooh. Oh, Jen started a CNA class this morning. Well, welcome. But Carrie Ann passed the exam Wednesday. Congratulations. Oh, I love those comments when they come in. All right, so let me talk to you guys about the privacy curtain real quick. Just going to turn this. My automatic turner is not working. Okay. So if I'm going to do my opening, hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I need to do some range of motion on your arm. Is that okay? All right. I'm going to close your curtain, wash my hands, and get my supplies. Now, I've got to do it in that order. I have to have clean hands to touch supplies. Makes sense, right? But let's talk about this curtain. For the test, the curtain is not going to go all the way around the bed, because the whole purpose is we got to see what you're doing. So the curtain's just going to go like a little way, like here. Okay, good. Makes sense? All right. Who touches this curtain, though? Patients touch it. They got germs. Roommates touch it because they have to get through to the bathroom. CNAs touch it because they got to open and close it for skills. Visitors touch it and they pick their nose in the elevator. Yeah. Nurses touch it after doing wound care or emptying the urine bag. Is this curtain clean? Not in any universe. Now, this is no shade on housekeeping at all, right? Housekeeping does a very good job, but they only take this thing down and wash it, like physically put it into a washing machine once a year. Now, in between, it's sprayed. Do I want to trust my patient's life to a can of disinfectant spray that might have missed a spot? So if we touch the curtain, what is on our hands? Yes. Do I want to take those germs to this patient? So what do I need to do before I touch the patient? Wash your hands. Those two actions should be tied in your brain for the rest of your life. If you touch a curtain, what do you need to do? Wash your hands. So at the end of the skill, when we're doing our closing, we're going to open that curtain and we're going to need to wash our hands. Good? Make sense? So every single skill that we do, we have to wash our hands before we touch the patient. Right? We can't touch the patient until we have clean hands. And we're going to wash our hands at the end of every skill, because we have to end skill with clean hands. So it's the very last action we do at the end of every skill. So we're leaving the patient environment with clean hands. So that first hand washing is for them. We don't want to bring pathogens to our patient. The last hand washing is for you. So you're not taking pathogens out of that patient's room. Okay, good. Make sense? You are graded on both hand washings. So step-by-step instructions are on page 31, but this is what it sounds like. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? I am here to insert name of skill here. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. I'll be right back. The best place to practice this is in your bathroom at home. Send everybody else out for ice cream because you'll sound funny talking to yourself. But you have a door to knock on. You got a person to talk to, the one in the mirror. You've got a curtain you can pull, the shower curtain, and you've got a sink right there to wash your hands. It is the best place to practice these steps. Write them on the mirror. Every time you go to the bathroom, practice your opening. Okay, good. All right. So these are the steps. This is the banner. You do need to learn this. You're going to hear it over and over and over and over and over again because we do it at the beginning of every skill that we do. But let's see if we can put all of these steps in order. So this is out of that online course. There's a video for you to watch on the opening. Explains all of them. But then there's this activity that we get to do together. Now, you would do this in the online course yourself, but let's do it together in here to see if we can put all of these steps together. So we need to figure out of all of these 8 steps, what the very first step would be. How do we know what to do with each patient? So the care plan would be our first step. Good job. Now, what do we want to do? Knock. Okay, I like that. So we'll knock. Now, what do we want to do? Whose name comes first? The patient's name. Okay. So we're going to identify that patient by name. Now, what do we want to do? I always think of that song, Say My Name, Say My Name. I can't sing though. All right, now what do we want to do? Explain the task. Okay, now what do we want to do? Close the curtain, and then we've closed that curtain, so we want to wash our hands, and now that we have clean hands, we're going to get our supplies. So let's see if we are correct. Let's hit that check button, and we got our gold star. We are correct. So every skill that we learn how to do, we have a sequencing activity like this in the online course to help you put all of those steps in the right order. Okay, this is a great way of practicing before you actually practice. That way you know the steps and you know the right order of those steps. Good? Okay, so the opening is done at the beginning of every skill that we do. The closing is done at the end of every skill that we do. And again, I have a video on this. And there's 8 C's to the closing. Now, the order of the opening mattered. We had to do everything in that right order. It was very important. The order meant something. With the closing, the order really doesn't matter how you do it other than the last 2. The last 2 steps, the order matters. But we really don't care about the rest of it. So this is the 8 C's. We want to make sure our patient is in a clean and safe environment. Patients rest better in a clean environment. It's just scientific fact. The more cluttered the environment is, the more anxiety people feel. It's just the way it is. So make sure they're in a clean and safe environment. Part of safety means the bed needs to be in the low position, as far to the ground as it can go. The reason, we'll get into this in a future lesson, but the reason for that is safety. We're not afraid the patient's going to roll out of bed. That's not what this is. When you get into bed at night, right, you're tired, you swing your legs into bed and you go to sleep. Now you're dead to the world for however many hours you're sleeping. And when you get up, you're groggy. You're not thinking straight. You're not really fully aware. You swing your legs out, and that floor is always right where you left it. That floor has never moved a day in your life. You've never gotten into bed and got out of bed, and that floor is not where you expect it to be. It's always there. If you don't have that bed in the lowest position, that floor is not going to be where that patient expects it to be. And what's going to happen when they try to get out of bed? They're going to fall. That's right. Because they're putting their weight down on something that doesn't exist. Does that make sense? So the bed needs to be in the lowest position that's clean and safe. We want to make sure the patient is comfortable. And we're actually going to say that word. They need to hear that word. Are you comfortable? They need to hear the word. But part of comfort is not just physical comfort, it's also emotional comfort. When you guys have like 2 spare seconds in your life, what do you grab? How do you fill your spare time? Say it out loud. Phone. Absolutely. If I all of a sudden said, okay, we're going to take a 30-second break, you know what you're going to grab? Your phone, right? You guys aren't even capable of going 30 seconds without some sort of mental stimulation and entertainment. Not 30 seconds. Why do you expect your patient to? And yet we will walk out of the room. The TV is off. They have nothing to keep their attention. We just want them to what? Stare at a wall? You think that's going to work? Do you know what they're going to do? They're going to hit that call light. You are now their entertainment. Congratulations. So part of comfort is emotional comfort as well. Entertainment, distraction. So we need to offer them a magazine or something, TV, I don't care, something to keep them off of that call light and out of my hair. Make sense? Good? So remember that comfort is also emotional comfort. So for the test, we're simply going to offer them a magazine, which shows that we understand this concept. Just one term that kind of encompasses everything. In a real setting, we're not passing magazines person to person. We're not doing that. But for the test, we're just going to say it so that they know we know that this is a thing. Good? Okay. We're going to adjust the head of the bed as needed. So unless the care plan tells us otherwise, this patient can have that head of the bed any way they want to. They can be sitting all the way up. They can lay down. They can be somewhere in between. But we can, if they want it adjusted, we can adjust it unless the care plan says otherwise. I'm going to tell you for the test, no care plan says otherwise. Whatever they want. We're going to open that privacy curtain and we're going to give the patient their call light. Okay. They have to have a way of calling us, and we don't want to isolate the patient. When we leave the curtain closed, it isolates the patient. Patient will get depressed and their intake will go down. It'll set off a cascade effect. That curtain's way more important than you think it is. Open the curtain. If the patient insists that the curtain remains closed, that's an observation. Who has to know? The nurse. Okay, good. Are you starting to see that if you can't follow the care plan, we have to notify the nurse? We only have 2 doors to walk through. We either follow the care plan or we notify the nurse. That's it. That is it. That is it. We don't think. If you catch yourself saying, well, I think, stop. The nurse is the one that needs to know. How hard can this test be, guys? We're not allowed to think. Okay? So once we've done all of that, now it doesn't matter what order you do all of those things because all of those things are dirty. Call light. Patients in bed scratch what itches and then hit the call light to tell you about it. That's dirty. Curtain. Dirty. Magazine. Well, different type of dirty. Bed controller. Dirty, right? So none of this stuff is clean. Doesn't matter what order you do it in. Nobody cares. Just get all of it done. And then once you've done all of those things, you want to go wash your hands. We're going to get all of those cooties off of our hands. All of those cooties. But once you've washed your hands, you cannot come back to that patient environment. If you're over there washing your hands and you remember, oh my gosh, I didn't give them their call light, and you come back over here and you hand the patient their call light, You just re-cootied up. What do you need to do? Wash your hands again. Does that make sense? So our last action is hand washing, except if we have to document something. If I'm going to touch this pen goes in my pocket, goes home with me at the end of the day. It goes in and out of patients' rooms. It goes all over the place. I don't want to touch this pen with dirty hands. I have to have clean hands to touch this pen. So if I have to document something, and remember, everybody gets a documentation skill. If I'm going to document something, I'm going to do my closing, wash my hands, document, and we have to end skill with clean hands. So what do I need to do again? Wash my hands again. Good? Questions? All right. So again, I have a video for this. Explains all of those concepts. Now, this activity is going to be a little bit different because the order doesn't matter for the closing. We don't care what order you do it in, but this is going to be what we call a hotspot activity, where it asks you to click on all of the areas that need to be addressed during your closing. So opening the curtain, making sure the environment is clean, bed is in the low position, giving them their call light, washing your hands. All of those are going to be a clickable area. Good? Questions? All right, let's go to hand washing now. So if you go to page 44, hand washing is graded at the beginning and the end of your first skill. Sarai says, I passed my exam a few months ago. Thank you. Thanks to your skills videos. I just received a call this morning to confirm an interview with a hospital. Any advice on what to expect as a CNA in trauma? Oh, that's a great question, Sarai, and congratulations to you. Good luck on your interview. But those are great questions to ask during the interview, or what are some tasks that a CNA would be doing in this setting? If you look at my last, go to my YouTube channel for your CNA, look under live classroom live streams, class 8, we'll go over interview tips. It'll help you a lot getting ready for the interview. All right, so hand washing. We're going to wash our hands at the beginning and the end of the last skill. After that, they're going to tell us we can simulate hand washing. Where do those evaluators want to be? Home, in their pool, drinking their Mai Tais or margaritas. So let me explain to you how this works. You are here to test. You have 3 skills. You have to wash your hands at the beginning and the end of each skill. So that's 6 hand washings. Got that? And you have 6 hand washings, 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 and you have 6 hand washings. And if anybody does math, you'll realize that's 48 hand washings. Where do those evaluators want to be? Do you think they want to be watching 48 hand washings? No. So you're just going to wash your hands at the beginning and the end of the first skill. So they're going to watch 2. From that point, you would just say when you would wash your hands. They know you know how. They saw that. So you have to tell them when you would wash your hands. So simulate means say. Good? Okay. So if you go to page 44, I have instructions on how to wash our hands. So again, I have a video, and I'm going to show you the video. Normally, I do this live. I've got a camera over the sink, but my camera died. I was down here on Saturday trying to fix it. It kept zapping poor Jake. I mean, it was like zapping him. So that camera is unplugged and not working at the moment. So I'm going to have to show you the video. I apologize for that. I'm going to try to get a new camera before by the end of the week. So on this page, you'll see a video. I'm going to show you that. Hand washing is going to be part of the opening and part of the closing. This is the checklist that the state is going to use to grade you. This is your kind of synopsis, Cliff Notes version. These are all the steps we have to take, and then test specific information. I got step-by-step instructions here on page 45 for you. It talks to you a little bit about the testing process here, and it has some practice questions as well. So let me show you this video, but when you're washing your hands, there's a couple of things we need to be aware of. First, you can touch the faucet. Your hands are not clean. The faucet, not clean. Perfectly okay. Touch the faucet, turn it on. You're unclean. No problem. Get the water comfortable. Doesn't have to be hot. A lot of people think you got to use hot water to wash your hands to kill the germs. Guys, you'll never get it hot enough to kill germs. That would be boiling. You cannot wash your hands with boiling water. Okay? So just make it comfortable. Wet your hands. Now, this is a step that a lot of people miss out on. You have to wet your hands before you put soap on them, because you want that soap to be able to distribute across all surfaces. And if your hands are dry when you put soap on them, it globs in that one place. So you wet your hands, you put soap on, and we want to use a lot of soap. You're graded on bubble production. I am not kidding. I am not kidding. Go back to, where is it? Hold on. Let's go back to this page, right? You see number 2, use friction to distribute soap and create lather. Create lather. You are graded on bubble production. I actually had a student that failed because they didn't use enough soap. Get some soap. You're not paying for it. Use the soap. Okay. Here, I got good soap. It smells good. Okay. Oops. All right. So we're going to wet our hands. We're going to get some soap, lots of soap, and we're going to put them together. When we put them together, we want to look at the clock right above the sink. That clock is there for a reason. That is how the evaluators are going to grade your time. So when you put your hands together, whatever number that second hand is on, that evaluator actually writes down. So right now, the second hand is on 20. Let me wait till you. So 25 now. Okay, so I would write down 25. So you start rubbing. You have to rub for at least 20 seconds. At least 20 seconds. So we're going to rub the tops of our wrists, the backs of our hands, in between our fingers, in between our thumb and index finger, the bottom of our hand by our pinky, and the palm of our hand in between the fingers. We're going to rub all of these surfaces for at least 20 seconds. When you move to your nails, that evaluator looks at that clock and writes down where that second hand is. And if it's not at least 20 seconds between where you started rubbing and when you move to your nails, you failed hand washing. So those of you who were trained to sing songs, don't do that. What do you think happens to your singing when you're nervous? Speeds up. So that is not an accurate measurement of time. The evaluators are using the clock. You should be using the clock. Okay, good. So once you've rubbed for at least 20 seconds, you're going to move down to your nails. You're going to wipe each nail downward to clean your cuticles, just like this. And then you're going to circle your nails on the palm of your hand to get underneath those nails. Then you can rinse. Now, when you're rinsing, you don't want to touch the sink or the faucet or anything but water. That's it, because we don't want to recontaminate. That sink is the dirtiest thing in the bathroom. We touch it with dirty hands all the time. Don't touch the sink once your hands are clean. Then, once your hands have been rinsed, you're going to take some paper towels and dry your hands. It doesn't matter how many. I don't care. If you got little hands, use 2. If you got big hands, use 6. Nobody cares. Nobody's counting. So you'll take some paper towels, you're going to dry, but only dry what's clean. If I go up here with the paper towels, this has not been cleaned. If I go up here and then come back down here, what did I just do? Yeah, I spread germs. I contaminated. So only dry what's clean. Then we're going to throw that away. Now we got to turn that water off. Can I touch that faucet now? So I need a clean, dry paper towel to turn the water off. Now, why can't I use those paper towels that I just dried my hands with? Well, those are wet paper towels now, and wet paper towels tend to rip. If it rips and I don't notice, then the pathogens that are on that faucet are now back on my hands. Okay, so clean, dry paper towel that you can inspect before you throw away. Good? Questions? This is a 1.5-minute video, 2-minute video.
When you approach the sink, you can touch the faucet with your unclean hands because the faucet is considered the dirtiest object in the bathroom. Adjust the water temperature for comfort and wet your hands. Apply soap and rub all surfaces of your hands vigorously, focusing on the front and back of your hands and in between all fingers. Circle the top of your wrists as well. Friction is the key to removing all pathogens from the surface of your skin. Friction should be applied for at least 20 seconds to be effective. After washing with friction, the nails must be cleaned. Run one thumb down the length of each nail, starting at the cuticle and moving toward the end of the nail. Repeat with all fingers of both hands. Then clean under your nails by scrubbing the underside of your nails along your palm to remove debris. Carefully rinse your hands under the stream of water with your fingertips pointing downwards, taking care not to touch the inside of the sink or the faucet. Tap your fingers together to ensure that all water droplets remain in the sink. Take paper towels from the paper towel dispenser and dry all surfaces of your hands, the front, back, between your fingers, and your wrists, taking care not to allow the paper towels to touch the unwashed areas of your lower arms. Throw these paper towels directly into the trash bin. Finally, take a clean, dry paper towel to turn the faucet off, because wet paper towels may rip and recontaminate your hands.
All right. Any questions on that? Remember, you will wash your hands during your opening, after you close privacy curtain, and during your closing, after you open the privacy curtain. Don't touch the patient until you have clean hands. And at the end of the skill, after you cleaned your hands, don't return to the patient.
About the rings.
So rings are not graded on the state exam. Okay, you can wear rings, you can wear bracelets. There's no problems with any of that, but they're going to grade your cleaning a little bit harsher. They're going to see that, whether you wash around the rings, under the rings, around the bracelet, under the bracelet. So you really want to make sure that you pay very close attention to your technique if you're wearing jewelry of any sort. If you notice in here, when I'm doing clinical skills, I don't wear any of my rings. I don't wear a necklace. I don't wear any jewelry. This is exactly how I would go to work. What you see is exactly the way I would be at work. I am married. I do have rings. I do have bracelets. I do like to pretty myself up occasionally when I'm not in front of the computer. But work, I choose not to, primarily because I had a very bad experience early in my career. I had a wedding ring on, different husband, different ring, a wedding ring on. I had gloves on, and I was working with bariatric patients or patients that were very severely obese. This patient was probably about 350, 400 pounds. bedbound. And I had her on her side, and I was cleaning her up and putting a chucks underneath her. Well, when I put the chucks underneath her, she rolled back onto my arms, and they're both now trapped under this patient. So the only choice I have is to pull them out. And when I did, my ring broke the glove and gouged her skin. I mean, it gouged. It's 400 pounds of pressure down onto that ring. It gouged her. And now I've got skin in my ring that is going to go home with me. And I don't care how much you scrub that ring, you're never going to get it all out. So do I want to make meatloaf with that ring? You know. So because of that, at that time, from that point on, I never wore another ring in a clinical setting again. I got a chain. I would wear my rings on the chain, but I never wore a ring in a clinical setting after that, just because the ick factor was pretty high for me. Not to mention what it did to her. You know, I mean, she now, when you are that big, you are not going to heal well. You know, you're bedbound. So I now gave her a huge wound that we're going to have to work really hard to try to get healed in an area that's subject to moisture and is dark. And that's going to lead us right here to warm, dark, moist. This is where pathogens proliferate. Warm, dark, moist. That's the environment that pathogens prefer to be in. So bathrooms are usually warmer because we don't like to be chilled when we get out of the shower. They're dark because mom trained you, turn the light off when you go out of the bathroom. And when you shake your hands, you create pockets of moisture all over that bathroom. Well, that allows bacteria to just procreate. When you walk through that bathroom, you're picking up all of those pathogens onto your shoes, and you're taking them all throughout your facility and home with you at the end of the day. So if you notice in the video, I tapped my fingers over the sink. I did not shake. When you shake, water goes everywhere. When you tap, it keeps the water confined to the sink. So you end up with less pathogen transfer by tapping. Okay? We should always look for warm, dark, moist environments. So between your toes, when you have socks on, warm, dark, moist from sweat. My patient, that wound, warm, body heat, dark, she's laying on her back, moist, wound drainage. So that is the ideal environment for pathogens, which means her risk of infection, very high. Good. Okay, we just went over this. All right, so each of these steps is going to correspond to a step on the checklist. So if you follow the steps I showed you, you'll be fine on the test. These are areas that are missed quite frequently when we're washing our hands, everything in red. For some reason, the back of the thumb gets missed a lot. And in between your ring finger and pinky, pay attention to that as well. Wet your hands, apply lots of soap, rub for at least 20 seconds, move on to your nails, cover all your bases, rinse and dry. Remember that you must rub for at least 20 seconds, not counting your nails. So once you've done your nails and you've rinsed, go here, then you're going to tap to keep the water in the sink, not in the environment. Get some paper towels, dry your hands, throw those away, and then get a clean, dry paper towel to turn the faucet off. So those are all the steps. Let's see if we can put these steps in order. So again, this is in the course. This is the video that we watched. If you click on the care plan button, it brings up the care plan. If you click on the checklist button, it brings up the checklist. There's the video. And here is our activity. So what do you think should be our first step here in hand washing? Yeah, turn the water on. Yeah. What do we want to do next?
Wet hands.
Wet hands. Very good. Now what do you want to do?
Soap.
All right. Now what do we want to do?
Rub.
Lather all surfaces. For how long?
Test.
At least 20 seconds. All right. Now what do we got soap on there, so we've got to Rinse, all right. And then what do you want to do?
Dry.
Dry, and then turn the water off with a barrier. So let's see if we're right. Look at that. We got a gold star. Good job. All right. We already talked about stimulations. Indirect care. Man, I am good. 3 minutes. Told you, indirect care is going to take us about the last 2 minutes. All right. Indirect care is how we treat the patients while we are doing the skills. So indirect care, if you treat the patient the way you would want to be treated, if you were the patient, you'll do just fine. How would you want to be treated if you were the one in the bed? It is graded on the state exam, and these are the things that it's going to affect our indirect care score. Eye contact. Remember, half of our job is observation and reporting. If you're not making eye contact, you're not making observations. Tone of voice. Like, right now, my tone of voice is pretty good. Are you kidding me? Right? That is not a good tone of voice. So watch your tone of voice. Now, if we're having a bad day, it's really easy for that to creep into our tone of voice when we're dealing with another patient. Be careful. Facial expressions, body language, explanations, posture, and overall attitude are going to affect how your patient reacts to you. So this is all indirect care. Remember your homework. You're going to read chapter 1 in the yellow book. You're going to take the test on page 181 in the spiral book, and you're going to grade it using the grading scale on page 201. Now on Saturday, I have a CPR class. It starts at 9 a.m. You don't have to pre-register. For you guys, it is only $45. After you graduate, that cost goes up to $55. You do not need CPR to test. You do not need it for the class. You will need it to work. You will need CPR to work. So you can, are you going to get it for 45 or 55? It's up to you. So Saturday I have a class. You don't have to pre-register. Just show up on Saturday. The last Monday of our schedule, I will have a class in the afternoon. Okay? So week 4 Monday in the afternoon, I will have another CPR class. So those are your 2 opportunities to get it for 45. You'll get an email on it. You'll get an email. All right, so now I'm going to pass out the review sheets. Those of you who are joining us online, you can get the review sheets on flcnatraining.com. This reviews everything that we have gone over in class today. It is double-sided. It has all the principles. It has our CNA happy place, and it has some questions on the front. If you do these at the end of every CNA class, okay, take one and pass it on. If you do these at the end of each class when I hand these out, and if you miss, I think I might give you one extra. If you miss a class, they're always right there in the organizer right by the door. Just grab the ones that you need, okay? But if you do these at the end of every class, it makes a great review packet right before you test. Right before you test. So this is a very, very helpful resource for you. And again, they're going to be online on flcnatraining.com. Yeah, I thought I gave you guys 1 too many. Okay. All right. Does anybody have any questions for me? No? Did I go too fast? Is everybody coming back? I didn't scare anybody off? All right. The following people need to see me after class: Samantha, Janiyah, Kaylee, and Luz. Make sure you see me after class before you leave. The rest of you are free to go. Thank you so much for coming. I will see you on Wednesday. Have a fantastic day. And those of you who joined us online, thank you so much for joining. We'll be back on Wednesday for class 2. Hope to see you then. Until then, happy caregiving. Bye.